Good evening, everyone. We'd like to get started, so please find a seat if you're in the audience. And we've got some youngsters here, and we want to start going because we don't want to keep them here too long. And I'm sure nobody else wants to be here too long either. So we are back from our recess, and we're going to take up House File 1818. And Representative Melin is here. And so since she's not a member of the committee, I will move that House File 1818 be re-referred to the Committee on Government Operations. So Representative Melin, I understand that you have an amendment to get the bill in the order in which you would like us to consider it. And is that the A3 amendment?
Madam Chair, thank you. That would be the A6 amendment.
Oh, the A6 amendment.
And
okay.
Madam Chair, I also have an oral amendment to the amendment.
Okay. So the members, the A6 amendment, and what would we can incorporate a change into the A6 before we adopt it. So what would the change be, Representative Melin?
Madam Chair, page 1, line 15, change market to marketing.
Okay, line 1.15, change market to marketing. Everybody have that? Okay, so I will move the A6 amendment to put the bill in the order in which the author would like us to consider it with that incorporation. All those in favor, please say aye.
Aye.
Opposed? Motion prevails. So, Representative Melin, we now have the bill in the order in which you wanted us to consider it. And go ahead, you have the floor.
Thank you, Madam Chair and members. Thank you for all being here this evening. I know our days are getting pretty long this first week already, so I do appreciate you taking the time to be here tonight. I think we all know why we're here, to enact a medical marijuana bill in Minnesota that would allow legal, safe, and regulated treatment for patients who need it and who need treatment with medical marijuana. And I know that we have a lot of people here to testify, people that drove from all over the state to be here this evening, including families and children who have far more important things to say than I do. And so I'm going to have House Counsel help me out here with presenting the bill and the sections before we get into testimony from the public who's joined us here this evening. And so if Ms. Olson could walk us through the bill.
Okay, thank you very much, Ms. Olson. So for the audience, Ms. Olson is from our House Research Department, and she's just going to walk us through. Welcome to the committee.
Thank you, Madam Chair and members. I'm going to start with Section 1 of the bill. This refers to data practices. This section of the bill is just adding a cross-reference to Chapter 13, which is customary when data collection statutes exist in another chapter of Minnesota statute. Section 2 of the bill defines terms used throughout the bill, a couple notable terms that are defined in Section 2. One being the allowable amount of marijuana that begins on page 1, line 13. This definition states that for patients and caregivers, the allowable amount of marijuana is 2.5 ounces. If that patient or caregiver is allowed to cultivate marijuana, it will now be 6 plants that they will be allowed to cultivate. That is part of the A6 amendment, decreasing 12 to 6 plants. The allowable amount of marijuana also includes marijuana produced from the plants while the plants stay on the premises where they are allowed to be cultivated. On page 2, line 17, Section 2 defines a debilitating medical condition. Paragraph 1 lists specific conditions that qualify as a debilitating medical condition. It includes the treatment of those conditions as well. Paragraph 2 states that chronic or debilitating diseases or medical conditions, including treatment, that produce severe nausea or pain, seizures, severe and persistent muscle spasms, Crohn's disease, etc., would also be included as a debilitating medical condition. Paragraph 3 includes HIV if the physician believes that marijuana would be of a benefit to the patient. And paragraph 4 allows any other condition or its treatment approved by the commissioner to qualify as a debilitating medical condition. Lastly, Section 2 also defines a written certification that is on page 4, line 10. This is what patients will need from a licensed practitioner in order to become a qualified patient. The bill states that a patient will receive a written certification if the patient is likely to receive therapeutic or palliative benefit from the medical use of marijuana to treat or alleviate the patient's debilitating medical condition. Moving on to Section 3 of the bill, Section 3 lists actions that are still prohibited under the bill, including one that was added under the A6 amendment, which is reimbursement by medical assistance or Minnesota Care is not required under the bill. Section 4 authorizes the Commissioner of Health to develop rules regulating the sections of this bill. Section 5 outlines medical marijuana organizations. Medical marijuana organizations include both medical marijuana dispensaries and safety compliance facilities. The difference between them, as defined in the Section 2 definitions, is that a dispensary is used for the cultivation and supply of medical marijuana, and a safety compliance facility is for consumer protection, including laboratory testing, public information, and training services. Section 5 also outlines the registration requirements for the medical marijuana organizations, as well as the location restrictions for how many medical marijuana organizations may exist in certain locations. One of the amendments from the A6 amendment is adding an exception to the location restrictions, which states that a county with greater than a 5,000 square mile radius must have at least 2 dispensaries regardless of the population. Moving on to Section 6 of the bill, this refers to the registry identification cards. These cards are issued to both qualifying patients and designated caregivers. Subdivision 1 outlines what the application by a qualifying patient must include. Subdivision 2 outlines the steps that the Commissioner of Health must take in order to issue a registry information card, including issuing cards to persons under the age of 18. Subdivision 3 outlines the contents of the registration card, including a random 20-digit alphanumeric identification number, which is unique to each cardholder and used throughout the bill as well. Subdivisions 4 through 6 outline the denial, expiration, and loss of registry identification cards. Moving on to Section 7, which is for notifications. Section 7 requires that cardholders, both patients and caregivers, notify the Commissioner of any changes, including personal information, as well as changes regarding the debilitating medical condition that originally qualified the patient. Section 7 also requires medical marijuana organizations to notify the Commissioner within 1 business day of any theft or significant loss of marijuana on the premises. Section 8 refers to the medical marijuana organization requirements, and this section outlines the requirements for both dispensaries and safety compliance facilities. Some of those requirements include security on the premises, staffing requirements, and also the acquisition of marijuana from qualifying patients, so long as there is no compensation. Section 9 of the bill refers to the medical marijuana organization locations, and this section allows a city to enact reasonable zoning rules that limit the use of land for dispensaries or safety compliance facilities to specified areas. Section 10 of the bill allows nursing facilities and boarding homes to adopt reasonable restrictions for the use of medical marijuana within that facility. Section 11 refers to a verification system that will be developed by the Commissioner of Health. It will be based on the 20-digit alphanumeric number that is assigned to each cardholder. And this system will be used to determine whether the number corresponds with a current valid registry identification card. The system will contain limited information. Section 12 requires an annual report from the Commissioner of Health to the legislature. Section 13 refers to the confidentiality of data collected under this act and states that the submitted data will be classified as private data on individuals or non-public data as defined in Section 1302. Section 13 also goes over what the Commissioner is allowed to disclose information for and how information shall be kept by the medical marijuana organizations. Section 14 relates to the protections for the medical use of marijuana. This section refers to court procedures, arrest and prosecution for cardholders, protections for medical practitioners and attorneys, and also criminal charges related to people in the presence of authorized use of medical marijuana. Section 14 also refers to the medical marijuana dispensaries and the safety compliance facilities, and that no discrimination can be used by schools or landlords against qualifying patients or designated caregivers. Moving on to Section 15 for the affirmative defense. This section applies only in situations where charges came after the effective date but before registration was available, or charges after a valid application has been submitted to the Commissioner but before a registry card was received. Section 16 refers to suspensions and revocations, and it outlines the procedure for the Commissioners to suspend or revoke certificates for medical marijuana organizations and registry identification cards for both patients and caregivers. Section 17 outlines the violations, which include both civil and criminal penalties for violations of the bill ranging from petty misdemeanors to felonies. Section 18, implementation, includes the dates of implementation of the program by the Commissioner and allows any citizen to commence a mandamus action should the Commissioner fail to take certain action within the specified time period. Section 19 states that fees are annually appropriated and deposited in the state government's special revenue fund for use by the Commissioner to administer the sections of this bill. It also requires that the total amount of revenue be sufficient to implement and administer the sections in this bill. Section 20 in the current bill has been amended by the A6 amendment. The new Section 20, it refers to the drug formulary for medical assistance, and it will exclude marijuana for medical use from the medical assistance drug formulary. The appropriations section moves to Section 21, and it appropriates money in fiscal years 2014 and 2015 from the state government special revenue fund to the Commissioner of Health. And the new Section 22 will be the effective date, which will be July 1st, 2014.
Thank you very much. And so I think, members, this would probably be a good time for me to sort of restate the principle here that since this is a health committee, it is my intention that we would hear this bill with the considering its health impacts. Obviously, from Ms. Olson's run-through of the bill, there are a lot of sections here that really pertain more to other committees, such as the control features. There are criminal penalties in here, and the next committee is government operations. So I'm sure this is going to go probably also to civil law. It probably has to go to public safety. It has a lot of stops to make. So obviously this is a bill that has a lot of pieces. We could spend many hours debating all of them. I hope we won't do that. I hope our testimony will be related to the medical aspects of the bill, and that our questions and comments would be to that portion. And then those of you who sit on these other committees will have other opportunities, probably, one hopes, to discuss those. So with that, Representative Melin, do you want to call your first testifier?
Yes, Madam Chair, and I just wanted to thank Ms. Olson for going through the bill. This is the first time I've had the honor of being in front of the Health and Human Services Policy Committee, and I didn't realize Ms. Olson is also new to the House Research Department, and so I told her this is sort of baptism by fire to ask her to present this bill with all the media coverage and the people that are here this evening. So she did a really great job of running through the bill, so I wanted to thank her for that. Thank you.
Okay.
And Madam Chair, I believe our first testifiers are Angie and Josh Weaver with their daughter Amelia.
Very good. Welcome to the committee. And just come on up and take a seat. And we have a little formal procedure that we have to observe in these committees because we're taping everything. Okay. And so we do this sort of stilted back and forth where I have to recognize you before you speak and that kind of thing. But what you could do is just give us your name so that we get it on the tape, and then go ahead and give us your testimony.
Okay. Hi, my name is Angie Weaver. This is my husband, Josh Weaver, and our 7-year-old daughter, Amelia Weaver. We also have a 3-year-old, Penelope, who is home with her grandparents. Thank you, Madam Chair and members, for having my family here tonight. I'd like to tell you a little bit about my daughter, Amelia. Amelia was born a beautiful, healthy baby girl. The first 2.5 years of her life were a dream come true. She was walking, talking, speaking in sentences, counting to 20, singing her ABCs. Her favorite activity was reading storybooks. She even memorized the words to Clifford the Big Red Dog and would read them like a big girl back to us. When Amelia was 2.5 years old, one morning my husband and I found her having a seizure in her crib. We immediately rushed her to the emergency room. By the time we got there, that seizure had stopped and another had started. She went on to have 4 seizures before they sedated her to the point that they stopped. This was the scariest moment of my life. To see my little baby having a seizure is something I wish no parent ever had to go through. We spent the next 4 months in and out of hospitals. They gave her anticonvulsant after anticonvulsant. Nothing worked. These anticonvulsants gave her a severe allergic reaction, hyperactivity, weeks of vomiting, nausea, and of course always seizures, so she needed to be supervised 24/7. After 4 months of basically being in and out of the hospital, Amelia lost the ability to walk, talk, and communicate. With 3 anticonvulsants and a special diet, Amelia gained some seizure control. She slowly regained the ability to walk and talk. However, this did not last long. Since then, Amelia has had over 1,000 seizures. At age 4, she lost the ability to speak or communicate in any form. She's regressed developmentally, cognitively, and is now globally delayed. At age 6, Amelia was diagnosed at the Mayo Clinic with Dravet syndrome. Dravet syndrome is a rare catastrophic form of epilepsy. It's hard to treat, there's few treatment options, and anticonvulsants rarely work. This was a devastating diagnosis to get. My daughter is at a much higher risk for sudden unexplained death and epilepsy. The kind of people that my husband and I are people that refuse to believe that this will be my daughter's life, that she will have no quality of life. We immediately started researching what other families are doing with children with Dravet syndrome. We discovered that they are having huge success treating their children with this specific form of medicinal marijuana. This form of medicinal marijuana is high in CBD and low in THC. My daughter just had a seizure, which she has 30 or more of every day. It's high in CBD and low in THC. It is extracted, mixed with an oil, given in a dropper orally, just like her other medications. These children are gaining seizure control. And when your child has Dravet syndrome, I cannot tell you what seizure control means. You have a life. Not only are they getting seizure control, but they're making gains developmentally and cognitively. Children that could not speak, like my daughter, are starting to talk again. It would be the best day of my life if I could hear my daughter say mommy again. They're also finding that it's actually repairing past damage done by seizures. After reading the stories, watching the news stories, talking to some of the 100 of families that are out treating their children with this form of medicinal marijuana, I turned to my husband and I said, we have to get this for Amelia. With further research, we discovered the only way to get the medicine that my daughter needs is to move our entire family to a different state where it's legal, or to help in Minnesota to get it legalized. Now, we will do anything for our daughter, and we have, including moving. But I don't believe we should have to. Amelia deserves safe legal access to the life-changing medicine that she needs. We are out of options and out of time. It's hard to explain to you what having a child with such extreme medical needs is like. As a family, we depend on our support system more than most families do. Both my husband and my parents live in our town of Hibbing. They help us in so many ways. They are the only people that have ever watched Amelia. If we didn't have them, we'd have to hire a nurse if Josh or I ever wanted a break. They shovel our snow. They bring us meals. Josh's dad is the pastor of our church. They provide us much encouragement and support. My husband works in the IT department at Hibbing Community College. His coworkers have been awesome. He loves his job. Thinking about leaving his job, where he's a state of Minnesota employee and has great health benefits, is a very scary thought when your child has such serious medical needs. We don't want to leave Minnesota. Minnesota is our home. My daughter has tried over 20 anticonvulsants. She has brittle bones, liver damage. She has sleeplessness, hyperactivity, nausea, vomiting, all of these things, and it's not working. We have tried what is out there for my daughter. She deserves safe legal access to life-changing medicine. I just want to end by saying two things. Since we have told our story, which is hard for us to do, it's a very private thing and we are private people. No one wants to tell anyone how terrible your daughter is doing. We have connected with family after family in Minnesota who said, my child has seizures, we need this, thanks for telling your story. My loved one's going through this, we need this as well. We are just one of the many, many families in Minnesota that need and want this for our child or our loved one. And last, I just ask that you would take a moment to imagine if Amelia was your daughter, granddaughter, niece, or loved one, what would you do for her? And I'd ask that you do the right thing. We have a long drive back to Hibbing, and my daughter obviously has a lot of medical needs, so I'd just like to ask if you do have any questions for us, we are more than happy to answer those right now for you. Thanks for having us.
Thank you very much. And members, do you want to ask any questions of this testifier? Yes, Representative Grunhagen.
Oh, thank you, Madam Chair. Thanks for your testimony. I'm sorry that you're in the situation you are, but Lord willing, she'll come through it and grow up to hopefully experience as normal a life as possible. One blessing she has is caring parents and a caring community. But you use a particular oil, is that what it is? Mm-hmm. And it's got a low level of THC? Mm-hmm. That's correct. So does it have hemp in it then?
Ms. Weaver, okay. So now here we get into this funny little procedure. So come on up to the mic and give us your name and go ahead and answer.
Madam Chair, my name is Josh Weaver. In answer to your question, I don't know that it's called hemp. It's a marijuana plant, and they extract this CBD oil, cannabidiol, and it is high in that and low in the psychoactive component of THC.
Representative Grunhagen.
One quick follow-up, Madam Chair. So do you get that through, or you can't get it at all right now?
That's correct.
Okay.
I'd further like to say,
Ms. Weaver. Yeah, go ahead.
if Minnesota does not legalize and we have to move out of state, Amelia will never be able to come back for Christmas, weddings, family events, because it's illegal in Minnesota. So whatever state we move to, Amelia will never be able to come back and see her family, who she's so connected with.
Okay. Thank you very much for your testimony, and have a safe drive.
Thank you.
Okay. Next on the list, I have a list here. I don't know, Representative Melin, if you want me just to go down the list that we have in the order, or do you have another order?
Madam Chair, I think you have the correct order, so if
Okay.
you just go through the testifiers.
Okay, so Joni Whiting? So after Ms. Whiting is going to be Dr. Sue Sisley, and then Councilman Andrew Johnson, then Jessica Hauser, just so that you can be ready to come up. Welcome to the committee.
Good afternoon, or evening. My name is Joni Whiting. Are we done with that part?
You're live, but maybe you could move a bit closer to the mic.
Okay.
There you go.
Like that?
That's
Is that
great.
better?
Perfect.
Okay. Good afternoon. My name is Joni Whiting, and I appreciate the opportunity to tell my story. However, I want to be clear from the outset. There's nothing being done here in this room today that will benefit my family or me. There is nothing you can give to ease our pain. I will suffer for the rest of my life for what I have lost. I am here today only to tell you about a woman I loved and lost 11 years ago. I ask only that you listen to her story, to walk just briefly in her shoes and mine. My daughter Stephanie was a wife, a loving mother of 3, and a beloved employee of Dark Distributing. Stephanie had a unique and beautiful voice, the voice of an angel. Stephanie was sweet and a gentle woman, the kindest human being I have ever known. In June of 2000, at 24 years of age, Stephanie was diagnosed with melanoma skin cancer on her face. A mole had gone bad during her 3rd pregnancy. The next 2 years were filled with experimental therapies and endless surgeries as they cut her face off 1 inch at a time until there was nothing left to cut. The skin grafts had failed. There was nothing to cover the hole in her face. All but 4 of her teeth had been removed due to the side effects of her chemotherapy. It was difficult for her to eat. The nausea was so severe that the medications gave her little to any relief. A doctor at the hospital pulled me aside and told me she may get some relief from smoking marijuana. But that wasn't an acceptable option for me or her being drug-free. In addition, the legal ramifications associated with illegal use was frightening. After her 10th surgery, all efforts to save her life had failed, and her oncologist predicted that she had about 6 months to live. At that time, I estimate she was taking approximately 40 to 50 tablets of OxyContin and 30 to 40 tablets of roxicodone per day. A consequence of the long-term use of pharmaceutical opiates was the ever-increasing amount needed to give her relief. Yet her pain was still evident in her every breath and in her every movement. Her whole body was racked with continuous and uncontrollable pain, and her tumors continued to grow. There was nothing to stop it, nothing to slow it down, and the hope of a miracle faded as my child bravely began to make plans for the ending of her life. When Zofran, the anti-nausea drug, continued to give her no relief, Stephanie began to lose weight. We asked her doctor to prescribe Marinol, a synthetic version of THC, one of the active chemical compounds in marijuana. But even taking this in pill form didn't abate any of her symptoms, and she stopped taking it because it didn't work. As her tumors grew larger, it became more and more difficult for her to eat. They were growing inside and outside of her mouth, her throat, and her chest. My other adult children begged me to let her use marijuana, and when I refused, they took her out of my home. When she came back 3 days later, Stephanie told me she'd gotten hungry after using it, and that the marijuana had kicked up her appetite, as well as allowed her to keep the food down. She had eaten 3 meals a day at a time when she'd routinely eaten nothing for days. She had just a touch of energy back, and she looked better than I had seen her in months. For reasons I don't know, marijuana also enhanced the effects of Stephanie's pain medication and didn't make her appear high. My only regret is not allowing her to use marijuana in my home throughout her illness. The fear of being caught was significant, but desperate. I called a number of family members and friends of our family and asked if they knew anywhere we could purchase marijuana. The next morning, someone had placed a package of it on our doorstep. I have never known whom to thank for it, but I remain grateful beyond belief. I was prepared to defend my daughter's use to anyone who asked. In retrospect, I can tell you with conviction that I would have no problem going to jail for acquiring marijuana for my suffering child. The law is unjust, and I would rather spend the rest of my life in prison than have denied her the marijuana that kept her pain at bay and allowed her to live 89 more days by simply being able to eat. Martin Luther King Jr. once said, quote, "I submit that an individual who breaks a law that conscience tells him is unjust and who willingly accepts the penalty of imprisonment in order to arouse the consciousness of the community over its injustice is in reality expressing the highest respect for the law," unquote. I am here today to tell you that I am no longer willing to support making criminals out of the sick and dying. I saw with my own eyes that medicine marijuana worked. I have dedicated a large portion of my own life to helping support people to stay clean and drug-free, and I see no contradiction in this at all. My daughter was able to eat for nearly 3 more months because of marijuana. I allowed her to use it in my home before meals because it worked and because every day of her life was precious to her and her 3 small children. We had Thanksgiving and Christmas with her at the table that year. Having her there was priceless. Shortly after the new year, Stephanie was placed on 24-hour nursing care and could no longer use marijuana. Her pain was so severe that when she asked my husband and me to lay down beside her and hold her, she couldn't stand the pain of us touching her. Her hospice nurses were so disturbed by the severity of her pain, doctor finally used IV lidocaine and numbed her whole body. The morphine, even at the strongest dose allowed by law, wasn't giving her any relief. On January 14th, 2003, at 1:30 in the morning, with her beloved children sleeping in their beds in other rooms, Stephanie stopped breathing, and 3 minutes later, her strong heart ceased to beat. She died in the room she grew up in, holding my hand. She was 26 years old. They say there is no greater loss than that of a child for a parent. They're right. For this government to deny those who need marijuana as medicine to lessen the severity of their pain, nausea, and seizures is unjustifiable. For this government to incarcerate the sick and dying and their loved ones for using or acquiring marijuana to use as medicine is unconscionable. For this government to seize their property, vehicles, and assets for having to acquire marijuana illegally for medical purposes is an abomination of justice. I'm a Vietnam veteran, and my youngest son has recently returned to Minnesota after serving 2 tours in Iraq. We are a family that honors this country, having served it in the military in every conflict since the Revolutionary War. I don't use drugs. I don't abuse alcohol. I didn't want to break the law, but I would gladly do so again if I ever had to. I've raised 4 of my own children and 2 of Stephanie's. I'm currently raising the last child my daughter had to leave behind. What would you have done had you been in my shoes? Could you sleep at night with your child screaming in pain? What price would you be willing to pay to relieve the suffering of someone you love? The fact is, you can't do anything for me, but there are so many others in similar situations right here now in Minnesota. They deserve compassion, dignity, and you fighting for them. You can provide some amount of relief to them by passing this bill. I am not asking you to pass this. I am begging you for every decent family that are currently walking in my shoes. Thank you.
Thank you very much, Ms. Whiting, and it's really not hard, I think, for anybody listening to you to imagine themselves in your situation, and we really appreciate your sharing with us today.
Thank you very much.
Are there questions, members? Okay, not seeing any. Thank you so much.
Thank you.
Dr. Sue Sisley.
I have a PowerPoint.
Okay.
It's supposed to be that they're helping me out with, so we'll see if we can get that going here. Thank you so much. So, while they're loading that, I'll just go ahead. I know we're short on time. So my name, Madam Chair, members of the committee, my name is Sue Sisley, and I'm not sure what that is. This isn't my laptop. It's your. There you go. Okay. My name is Sue Sisley. I'm a physician. I flew out from Arizona today, all the way across the country and took the day off away from patients to talk with you guys because I felt this was so urgent. And I prepared a PowerPoint, which I'm hoping you're going to be able to see, because I come from a state that has a 4-year history with medical marijuana laws, and I wanted to share some of our experiences so that you know what you're entering into, and you can go in with eyes wide open. So my job, I'm an internist, so I do internal medicine and psychiatry, and the bulk of my practice is basically providing, I take care of veterans and first responders that have PTSD and a number of other ailments, but I'm mostly doing primary care. My other job at the University of Arizona, where I'm on the faculty at the medical school, is I do research on marijuana. So I'm the principal investigator on probably one of the only FDA-approved studies in the state of Arizona looking at using marijuana in the treatment of combat vets that have PTSD. And I wanted to give you, I know there's a lot of discussion about how the research isn't sufficient, and there's not a lot of answers about why this research is being blocked. Apparently, a lot of people say that it's being blocked at the federal level, but there's no explanation. So I wanted to share with you just briefly our experience in trying to conduct this research so you can see how many barriers you run into trying to implement a study like this. Even if with FDA approval and university IRB approval, it is nearly impossible to do marijuana research in this atmosphere of prohibition. You got about there. Yeah. Okay, perfect. So, so what I'm going to do is I'm going to talk with you just briefly about our study, and then, I'm sorry. Oh, perfect. That's great. Let's see if you guys get it up there. I wanted to just mention, too, that I've not used marijuana personally. I have no participation in the marijuana industry. I don't write certifications. Just so you're aware, I'm a scientist and a physician, and this is what I care about, is trying to understand how this medicine works for patients. So can you guys see that? Okay.
Yes.
So you can see this is our study approved by the FDA over 3 years ago and still sitting in the pipeline waiting to be implemented. In the time that it's taken, now over 3 years, you may have heard the statistic about 22 veterans a day dying, committing suicide. And so if you think about 22 veterans times all the days in the 3.5 years that this study has been blocked, over 24,000 veterans have killed themselves. And I submit to you that many of these patients could have benefited from using medical marijuana. So I'm just going to give you a glimpse of how marijuana research is designed. You can see here we were looking at the safety and efficacy of marijuana in looking at 5 different dosages of marijuana, including a placebo control. So they actually have a 0% THC that you can buy from NIDA, from the federal government. And we were looking at treating folks that had treatment-resistant PTSD, meaning they'd failed several medication trials, failed psychotherapy, nothing had helped. And we were looking at both smoked and vaporized marijuana in our study. I want to just review, because many folks have never even seen how drugs are scheduled in this country. What's fascinating to physicians is that the drugs are scheduled, the definitions are made by the DEA, not by medical professionals. So law enforcement professionals are deciding what's the medical benefit of these various drugs. And you can see having a Schedule I drug means that you have absolutely no medical benefit and a very high abuse potential. And you can see here the physician community has always been baffled by the fact that marijuana is lumped in Schedule I with all these other highly toxic drugs, some very serious psychedelic meds, and it's sort of inexplicable to health professionals. But yet, if you look at Schedule IV, which the DEA defines as having very low abuse potential, you'll see drugs like Xanax, Ativan, drugs that are famous for being highly abused. So this, you can see the scheduling of this drug doesn't make any sense in a medical realm. And this is the reason why research is being blocked. The NIDA monopoly. NIDA has the sole authority to sell marijuana study drug to researchers in this country, the National Institute on Drug Abuse. So this is the only Schedule I drug that has this third review by NIDA. It's a really strange situation. So when we do studies on other Schedule I drugs, we don't have to go through NIDA. We get FDA approval, and we simply move to implement our studies. But marijuana is in this unusual category. It's the only one that's required to do this. And so since '68, the DEA has licensed this single facility to sell cannabis to investigators that need it for studies. But unlike the FDA, when I submit a study design to the FDA, they have to respond in 30 days. NIDA has no such timetable. They can take 10 months, 10 years, 20 years, and we have evidence of that where we asked them, this actually is a slide that's slightly old. 10 years ago, we asked them to sell us a marijuana study drug for a vaporizer study that was approved by the FDA, and that study is still sitting in the pipeline waiting for NIDA. So I think you can see why these studies and why, the physician community is crying out for more randomized controlled trials, but they aren't going to be there, and they won't be there for many, many years. And I think that you can see that these patients here have come from all over your state begging for relief, begging for safe legal access to a medicine that they know has worked for them. And I think that as you hear their stories tonight, I think you'll see how compelling this is and why I got involved in the research side of this, because I'm desperate to understand how this drug works and know more. And these patients have become the biggest experts. They are, true experts on this drug now. This drug, the fight for marijuana research has gotten tons of mainstream media attention. So this is just one example. New York Times, Washington Post, Atlantic Monthly have all highlighted the blockade of this federally regulated marijuana research and why we need to study PTSD. It's so clear that this illness plagues a huge percentage of our population. We know that actually this data is old. Now it's over 20% of our soldiers are coming back with treatment-resistant PTSD, and you can see the disability payments that have been that have been required to cover these folks who have difficult to treat PTSD. The meds that we have available right now to treat PTSD and other illnesses that are represented in this crowd, the FDA-approved meds for many of these illnesses, these intractable illnesses, are just not there. The FDA-approved meds sometimes give these patients onerous side effects and often are just ineffective. And you can see here for PTSD, there's only 2 FDA-approved meds on the market, Zoloft and Paxil. And any of you who know about these meds, you know that they come with sexual dysfunction, weight gain. Here are veterans trying to reintegrate into their family and plagued with all these awful side effects. The other thing that I really wanted to impress upon you today is that there is a legitimate biologic basis to using marijuana as a medicine, and it's the endocannabinoid system. This was the biggest discovery of the last couple decades. Every human body has an endocannabinoid system, and when you take exogenous marijuana into your body, whether it's vaporized, edibles, whatever, you're going to connect with that system. There are receptors throughout the body, CB1 and CB2 receptors, that react to this medicine. So there is a biological basis, very important to know. Just so you have an idea of the timeline then, our study, we worked with the FDA as a partner for a full year to design our marijuana study. So I want people to know that the FDA is not the blockade here. They have been true collaborators in trying to unblock the marijuana research. They see the importance of conducting this type of science, and they, deserve a lot of credit for understanding, for evaluating studies based on scientific merit and not on politics. And so the FDA should be lauded for that. But when they approved our study in 2011, and we sent that the same day to the DEA, 3 years later, we're still waiting for the government to sell us the study drug. So, and I just want to impress upon you that I know a lot of folks here might have trouble with the notion that this drug has to be smoked. It's very important to know that there are tons of different delivery mechanisms for this drug. Our study highlights vaporization, and you can see, I wanted to make sure you know that vaporizing, there are essentially no products of combustion when you vaporize. That's very important, especially for the physician community. We don't want to encourage people to smoke if they're going to be inhaling carcinogens. This option is very important. Edibles are very important. The oils and the possible infused products are crucial. This is why I'm involved in this effort, because I feel like a physician who is also a human being cannot rest knowing that there is a potential drug that is being forced to sit on the shelf, knowing that it could help reduce human suffering, and yet it's being shut out. So I have information about the Arizona program. I know we've got some incredible speakers here that want to talk, but I would be happy to answer questions about how Arizona has implemented we're a very conservative state. We were very nervous about this project, and we managed to embrace it, and we have some of the most conservative thinkers in our state who have now been won over by the impact it's having on our patients, and I'd love to share that story with you if you have questions. But I have further slides, but I don't want to. I'll touch on them if anybody has questions about that.
All right. Well, Dr. Sisley, thank you so much. Are you able to stick around?
Absolutely. I'm here all night. As long as you are.
Wonderful. Okay, members, do you have questions right now? Representative Gruenhagen?
Thank you, Madam Chair. Real quickly, are the alternative ways of administering marijuana just as effective as smoking it in terms of the effect on the patient?
Great
Dr.
question.
Sisley.
Yeah, thank you. Madam Chair and members, great question. I think what's fascinating, especially about the opportunity to vaporize, is it seems that vaporization even allows patients to titrate the dosage more precisely, where they're able to actually, adjust the dose, inhale just enough that they need for symptom control, and then stop. What's important to know, these patients here who are legit sick patients, they're not trying to get stoned. And when you're sick, it feels awful to be stoned and high, and they'll all attest the fact that they're just striving for symptom control. And I think the edibles are trickier because you don't have as much control. The onset of action is much later, and then it's a very prolonged half-life of the drug. So using edibles is tricky. Using the oils and the infused products are tricky, but patients learn how to use them. They do master it. And they're, like I said, these guys are definitely becoming the experts now.
Thank you.
Yeah. Other questions, members? Okay. Oh, Representative Schoen, I'm sorry.
Madam Chair and Doctor, I was just going to, I wanted to clarify one thing you said about the NIDA and the FDA. You said that the NIDA was the only Schedule I drug that they had control over, whether you could do research, and I know that you said otherwise you only had to get FDA approval versus the NIDA. Could you enhance that? Because when I heard that question, what came to mind was I'm curious, would you only need FDA approval to research heroin and not the NIDA?
Madam Chair, members, this is a great question. What's really amazing is that the FDA, once they've approved, we have an example at U of A, we have an LSD study, a Schedule I drug. Once the FDA has approved that, this is, for example, an LSD-assisted psychotherapy in treating PTSD and end-of-life anxiety. So once we get FDA approval, we then go to our university IRB, the Institutional Review Board. We get their approval to do research on human subjects, and then we simply purchase the study drug, whether it's the LSD, the MDMA, whatever Schedule I drug. We simply go to a research lab and purchase research-grade study drug. But you don't have to go through NIDA to purchase any other Schedule I drug. NIDA allocates this third mandatory review to the Public Health Service. So you may have noticed on the slide it said NIDA/PHS. The Public Health Service has this third redundant review. We've begged Congress. We've had numerous discussions with Congress urging them to work, to send a letter to HHS asking them to end this third redundant review. But we've made zero headway in 10 years. And essentially this research has been blocked for about 40 years. There are studies. I mean, you look on clinicaltrials.gov or do any kind of Google, you'll see thousands and thousands of marijuana studies. So you're saying, why is she saying marijuana studies are blocked? What you'll notice, though, is if you look closely at those studies, what happens is they tend to approve studies looking at only the harmful side effects of marijuana or the abuse potential of marijuana. But if you dare say that you want to look at the efficacy of marijuana, how effective is marijuana in treating various illnesses, those are the studies that go into a permanent review process that they almost never emerge from. Some do, but they're usually very, very small-powered studies that have the blessing of NIDA because they fit into NIDA's mission. NIDA's mission being to curb all illicit drug use and suppress any information that might suggest that marijuana has medical benefit. The government has already decided for us. Marijuana has no medical benefit. Schedule I. So that's why you'll hear the medical community, over the last few years fighting to demand that the government reschedule this drug. The scheduling doesn't make any sense. And actually, there are a lot of physicians who argue that the drug should simply be unscheduled. It should be treated as a herbal preparation because the truth is that this drug has remarkably low toxicity. The toxicity of this drug, if you look at our poison control centers in Arizona, like I said, we've had medical marijuana laws on the books now 4 years, and our poison control center calls have really not gone up at all. And we get 65,000 calls a year to those poison centers, and still only under 100 calls a year are even related to marijuana, and they're usually really mild things like, I feel dizzy, what do I do? Things that easily take care of themselves in an hour or two because the half-life of the drug is so short. So,
okay, thank you very much. This is fascinating, and I'm sure we could just listen to just your testimony all evening, but we do have quite a list of people, so if you can stick around, we would appreciate it. Thank you so much. Councilman Andrew Johnson, then we're going to have Jessica Hauser, then Patrick McClellan. So if you could be ready to go. Okay. So have a seat if you can there. And
I'll be out of your way in just a second.
welcome to the committee. Go ahead.
Thank you, Madam Chair. Excellent. And thank you, members, for this honor to testify today on behalf of this issue that's very important to me. My name is Andrew Johnson. I am the council member for Ward 12 in Minneapolis. I also was proud to move through our Intergovernmental Relations Committee support for a legislative agenda for medical marijuana that comes to our full council on Friday as a consent agenda item. But I'm not here to talk about Minneapolis's state legislative agenda. I'm here to talk about my own personal experience and my own personal interest in this issue. I have extreme glaucoma. I am 29 years old, and I have been through 3 eye surgeries now. And during my course of this, and actually I do want to mention my doctor, Alana Grajewski, incredible surgeon, and she is an asset to this entire region and the country. She actually does glaucoma surgeries on infants as well that are up just as new as 1 day old. And so it's a very, very, she's an incredible doctor. She actually splits her time between Minneapolis and working at the U of M and Miami, Florida. And in Miami, she is able to prescribe medical marijuana to her glaucoma patients. Now, when I went through this process, the last thing you want to do is go into surgery. But I had a very bad case of glaucoma. And they actually put me on a whole bunch of different meds. This one, Timolol, this can actually cause depression and anxiety. This one adds up. This can cause severe asthma attacks. Here's a couple other ones they put me on. They actually put me on literally every single drug possible. And I tell you, trying to keep track of which ones to take when is actually makes doing your taxes look easy. So another one they put me on, Diamox. This pill, it makes your face, your legs, your arms all numb and tingly. Horrible, horrible feeling. And actually, if you're on it long enough, I was told by my doctor that it will shut down your kidneys eventually and you will die. So these are the drugs used to treat glaucoma. But frankly, it wasn't enough for me. So these drugs are used to buy time before I went into surgery. And it's important to lower the pressure as much as possible before you go into surgery, because it not only means that less cells in your eyes are dying, it also means that you're much more likely to have a better outcome during the surgery. My doctor was not able to prescribe medical marijuana for me. And she told me, quite bluntly, you're on all of these different drugs. If you were in Florida, if you were in Miami, for a patient with a case like yours, I would prescribe medical marijuana. So I am so thankful, so lucky to have vision today, to be able to see all of you because of her. But because medical marijuana is illegal, I have less vision as a result. I'm 29 years old, and knock on wood, I'm going to be around for at least another 50 plus years. And every single day, I wake up and I realize I have less vision than I should because an option, a valid option, was not available to me. Is marijuana, medical marijuana, is that the first line of defense for glaucoma? Absolutely not. There are more effective drugs. But it has less side effect than a lot of these drugs. And it is a last resort in a case like mine to help save vision. And no person should have to suffer additional vision loss because a drug that can treat their condition, that can help improve the outcome of their surgery, that can help preserve some of their eyesight is not legal, is not an option for them. And that feeling, knowing that you cannot do everything possible to save your own sight, is a terrible feeling. And nobody should have to face that. So with that, I'll yield to any questions.
All right. I'm not seeing any right now, but thank you very much for being here.
Great. Thank you all very much. I would strongly urge unanimously passing this, and not just passing this, but also talking with your colleagues and getting them on board. It is so important to the people of Minnesota. It is important in Minneapolis as well for all of our residents and for our medical institutions to have all the options available. Thank you.
Thank you. Next up is Jessica Hauser. After that, Patrick McClellan, then Maria Boddicker, then Tim Majerus. So if you could just kind of be ready, you can get ready and move right in when it's your turn. So welcome to the committee.
Good evening, Madam Chair and members of the committee. Thank you very much for the opportunity to speak here tonight. My name is Jessica Hauser. My husband, Jeremy Hauser, and I are both citizens of Minnesota, and we are asking for safe and legal access to medical marijuana for our little boy. If you asked me the day our 2-year-old son Wyatt was born if I supported medical marijuana, I would have said yes, of course, for those who need it, not knowing that in the coming year, my son would be one of those who need it. And I would become a passionate advocate for medical marijuana to give to my sweet baby. When our son was 7 months old, he was diagnosed with a rare and difficult-to-treat form of epilepsy called infantile spasms. Despite its name, it's not something he will likely outgrow, and it is incredibly devastating. He suffers nearly 100 seizures every day. These seizures rob him of his cognitive development, his personality, and his overall quality of life. If they continue, his future is at best uncertain. We are blessed to live in Minnesota and work with some of the most renowned doctors in the world. Under their guidance, we have been able to provide Wyatt with the best treatments currently available. Unfortunately, these treatments have done little to stop his seizures. He has tried and failed 10 medications in his short life and tried the ketogenic diet and various vitamin and enzyme supplements with no success. Most of these treatments aren't without serious drawbacks themselves, many with side effects that are difficult for adults to endure, much less a child, much less a baby. He has endured 7 weeks of steroid injections that my husband and I have had to administer to him, a course of oral steroids at a dose better suited for an adult, and various anti-epileptic medications that sedate him, cause insomnia, affect his coordination, and make him very irritable and uncomfortable. Essentially, they cause him to live in an altered state that seriously affects his quality of life and ability to develop and grow. I've had multiple people comment on how my child appears, and they're very insensitive. Some people have even asked if my child is drunk. So I have a baby who looks intoxicated because of the medications that are available to him. He is currently on a controlled substance that we must monitor very closely, and weaning from it could cause serious withdrawal symptoms, including more seizures. If any of these options worked, we would be tremendously grateful, but they have not, and we are literally running out of things to try. In fact, at Wyatt's latest appointment with his epileptologist, we had a very candid discussion with her, and she would prefer that he try a treatment that is largely cannabidiol or CBD. You've heard the other patients mention that. A chemical extracted from marijuana, and it would be given to him orally. She would prefer this over existing anti-epileptic medications on the market because they are not known to be effective for his type of epilepsy, and they come with a host of side effects that could do more harm than good. As we have been researching this option for our son, we learned it is helping children with epilepsy like our son's, resulting in greater seizure control with minimal side effects. Children in Colorado and other states where medical marijuana is legal are receiving this treatment now, and they are seeing results now. Unfortunately, the current laws in Minnesota prohibit us from accessing this real and viable treatment option for our son. We love Minnesota, and we love our family, friends, and our lives here. We have an amazing network of support, and we love our jobs. We respect and care about the physicians that treat Wyatt and want their guidance in all medications that we administer to him. We don't want to move, but if this law doesn't pass, we'll be forced to leave to give our son the chance to have a better life. We will need to go to a state where we can provide our son with the medicine that he needs, with new doctors, and without our current support system. It is not easy for anyone to move, and when you have a child with special needs, it is 1,000 times more challenging and heartbreaking. We hope lawmakers consider a recent call to action to included in a statement issued by the National Epilepsy Foundation and support appropriate changes to state laws to increase access to medical marijuana as a treatment option for epilepsy, including pediatric use as supported by a treating physician. With that, we are begging you, the lawmakers, law enforcement, and Governor Dayton to make this medicine available to the patients of Minnesota who need it now, especially the children, including our son Wyatt.
Thank you very much. Are there questions? All right. I'm not seeing any right now. Thank you very much for your testimony. Patrick McClellan. Welcome to the committee.
Thank you. My name is Patrick McClellan. I have muscular dystrophy, mitochondrial myopathy, which is a rare genetic muscle disorder. I suffer from severe muscle spasms, peripheral neuropathy, and then also chronic pain. I also wear leg braces on both of my legs that help me walk. I lost my career, became totally disabled about 3 years ago, and I found that eating and vaporizing cannabis has a remarkable effect on reducing my muscle spasms and pain. I'm treated at Gillette Specialty Healthcare, and my doctors are aware of my use of cannabis and have told me that other patients have also reported the same result. I currently take 26 medications or 26 pills every day, a mixture of muscle relaxants, anti-seizure drugs, neuropathic painkillers, and along with high-dose vitamin therapy. One of the medications that I take is Dimox, the glaucoma drug, which I have just learned today damages my kidneys. One of the most intense and painful symptoms of my disease are the severe muscle spasms. We've all had a Charlie horse before. When my spasms occur, for example, in the calf muscle, the Charlie horse starts, then the muscles in the shin, the Charlie horse pulls the foot down, the muscles in the shin spasm trying to pull against it to pull the foot up, then tendons underneath my knee and my thighs will go, my abdominal muscles will go, and then will create a giant Charlie horse through my entire body. During an attack, I am unable to walk, eat, use the bathroom, dial 911. Prior to an attack, I do have warning signs. The muscles will begin to twitch, and that will let me know that something is about to happen. During the winter of 2010, I had an attack that was so severe I was trapped between my bed and the wall for 2.5 hours waiting for my wife to come home. I thought I was going to die. I kept thinking of my wife coming home and finding me dead on the floor. Sorry. Yeah, I'll never forget that the 2.5 hours, and I will do anything to prevent that from happening again. I was not originally convinced that cannabis could help my symptoms. I was a recreational user in my 20s, and I quit because I didn't like the high. But in 2010, after I had that attack, I had remembered that my uncle, who had multiple sclerosis, had used cannabis to help treat his muscle spasms. And then in talking to some friends of mine, they had suggested that I give it a try. So over a 6-month period, I did my own experiment. I currently wear 2 medications around my neck, which are emergency medications that I use when I'm about to have a severe attack. I alternated, when I got the warning signs, between using the medications I wear around my neck and vaporizing a very small amount of cannabis. The medications that I wear around my neck work 70% of the time, when vaporizing a very small amount of cannabis worked 100% of the time. The Food and Drug Administration have warned that one of the medications that I wear around my neck, by using it the way I do, which is putting it in my mouth and chewing it up, could be fatal. Along with the other medication that I wear around my neck, which is Xanax, which is highly addictive. Now I only use those 2 medications, chewing up the quinine and the Xanax together. I only use that when I'm about to have an attack outside my home, but if I am in my home, I will vaporize a small amount of marijuana, and if I do that, it will stop the attack immediately. I'm 47 years old, and I will do anything to help treat my disease, and I don't want to move out of this state, and I also don't want to be treated as a criminal for attempting to help treat my symptoms. Thank you very much for hearing me speak. Does anyone have any questions?
Yes, thank you very much. I'm not seeing any questions, so thank you very much for your testimony.
Great.
Representative Melin.
Well, Madam Chair, I just thought maybe Mr. McClellan, since he uses a vaporizer, now would be a good time to maybe explain how that works. I know that there's maybe some questions or confusion regarding that, and of course the doctor spoke about that as well, and I don't know if you'd be comfortable explaining how a vaporizer works, just so the committee understands what that means.
Sure, please.
With the
McClellan.
vaporizer, I take the marijuana and the dried plant material and then grind it up. And then the vaporizer is a heating apparatus that I will put a small amount of cannabis in, attach it into the heating apparatus that will heat it to about 375 degrees. It does not produce any combustion. The oils within the cannabis and the moisture in the cannabis produces the vapor, which is then drawn into the lungs, held for a few seconds, and then released. But you are not ingesting the burning plant matter. And my physicians at Gillette completely support my use of the vaporizer to treat my symptoms.
Okay, so Mr. McClellan, we just had a hearing recently on e-cigarettes, and I assume that that's the same device as what you're describing, or is it a different kind of device?
I have no experience with the e-cigarette machine.
Okay.
But the benefits of it, at least for me, and this works for me, that doesn't mean that it will work for somebody else. Maybe for somebody else, I did actually try consuming a brownie, but the problem with it, when I have an attack, the timing for it to get through my system, it needs to be right away. The medications I wear around my neck can stop a spasm. If it's going to work, will work in about 5 minutes. The vaporizer will work in about 2 minutes.
Okay. All right. Thank you very much. Any questions from that, members? Okay. Not seeing any. Thank you very much.
Thank you.
Maria Boddicker. And then we've got Tim Majerus, then Todd Mitchell, then Mary Ann Nelson. Please come forward. Great. Welcome.
Hello. Thank you so much, Madam Chairman and committee, for having me in tonight and to share our story. My name is Maria Botker, and I am a master's prepared nurse, but more importantly, a mother. This is my oldest daughter, Emma. She's 13. And this is my middle daughter, Laura, and she is 10. Our youngest daughter, Greta, is currently living out in Colorado right now. She is living there with her father right now. We are a happily married couple, so it's not because of that. But she is living in Colorado right now because she has been taking a specialized form of medical marijuana called Charlotte's Web since November 12, 2013. Greta was born in 2006. The most bubbly little, cute, roly-poly little girl you've ever seen. She has a smile that's contagious, and that came so early on. But at 5 months of age, when I was feeding her, I noticed a brief stare, 30 to 60 seconds, and I couldn't snap her out of it. And the nurse in me went, "That looks like a seizure to me." I called a physician that I work with, and immediately we were run through the gamut, MRI, right away, the next morning. MRI, EEGs, specialists. She was 5 months old. She was developing completely normal. And then these seizures started. At 5 months of age, we went to see a specialist, and they said, "Yep, she's having seizures, start this medication." We started the medication. The seizures increased, intensified. I called the physician back and I said, "These seizures are getting worse," and she said, "That may happen." It's not exactly the answer I was looking for at the time. We continued to watch her seizures intensify and get more frequent and more intense over the next 2 months. And at that time, a nurse friend of mine said, "You need to get a second opinion, and I want you to go to St. Paul." We went to St. Paul. fell in love with a epileptologist there that took care of us for the next 6 days in the hospital. During those 6 days, she was hooked up to EEG leads, and I don't know if all of you understand what that's like, but it is basically gluing several wires to your head, and you basically walk around hooked up to a cable everywhere you go. Some children on that unit are on those for weeks at a time, so the doctor can analyze their seizures. My daughter, thankfully, was only on it for 3 days because within the first 2 hours of her having EEGs, they diagnosed her with infantile spasms, a rare form of epilepsy that is characterized by horrible seizures in addition to significant developmental delay. This is the same type as Jessica was just talking to you about. I don't want to reiterate how difficult this is because Jessica just painted a perfect picture. There's nothing more scary than watching them have hundreds of seizures a day. It's just petrifying. A few years later, we've been through several medications and even a specialized diet that had her drinking whipping cream 3 times a day and eating more butter and mayo than you and I would ever even want in 1 week. In 1 day, we had to do this day after day. We tried this for 9 months with her. Initially, it worked a little, but then it didn't. It quit working. We still tried it because it was FDA. It was approved. It was like those FDA-approved drugs. It was approved. It was well-researched. We're going to do this. It was the most horrible diet that any mother would ever want to give her child. And it did not work. Let me tell you how excited she was when we went off of it, that she could eat roast beef, vegetables, fruits, everything. It was wonderful. The seizures continued, and they continued worse, more frequent, more intense. I want to give you a little picture of what a seizure looks like for Greta, because I know that a lot of different people in my nursing career, even I've met with a lot of people that really don't understand what a seizure looks like. And for Greta, her seizures involve her arms going out forward and her head dropping quickly and her bending at the waist immediately. That was very short. That was very calm how I did that. Normally, it is like this. Within a moment's notice, with no warning at all, her head drops to the floor immediately. Over and over and over again. Now, at 7 months age, it's easy to hold your child and keep her from harm. Right now, Greta is 50 pounds. She's 48 inches tall. And she's living with just one parent because we're separated because of the laws of the state. Can you imagine trying to hold a 50-pound child and keep her from hurting herself 12 to 15 times a day? She started having other seizures, ones where we finally got Greta to be able to stumble. I'm not going to say walk because it's not a walk. We finally got her to be able to stumble around the house. But now we have to be careful of that also because now she's got a new seizure activity called drop seizures where her whole body collapses to the floor at a moment's notice. These are the most scary. We don't know if one's going to knock her out. What one's going to cause major brain damage, even more than what the seizures are already doing. So at this point, when she was 4, our doctor said our next best option is brain surgery. That is never an easy topic. When you have a 4-year-old and they're saying the best thing we can do for you is cut open her brain. She was hospitalized again to see if she was even a candidate for the brain surgery, and she was. That was the most horrible day in my life, to take her back and lay her on the operating table for them to perform a brain surgery on her. I don't wish that upon anyone. She came out of that brain surgery like a rock star. She came out, before she went in, she wasn't walking hardly at all. She came home 5 days after her surgery, and she walked
our quarter-mile driveway with me holding her hand. She rocked it for 2 weeks. And then those darn seizures came back again, just as hard as ever. So all that brain surgery, all that craziness, for nothing. All that expense, for nothing. Greta continued to have seizures. And we got to the point where her doctor was telling us, maybe we need to try this medication again, because we've already tried and failed 17 medications. When he talked to us, when we first heard about medical marijuana, it was my mother that had heard about it from another gal that was observing Greta. My mom was so excited to tell us about it. And immediately we started researching. We found the Realm of Caring, which is a non-for-profit organization in Colorado who helps families such as ours gain access to this specialized form of medical marijuana called Charlotte's Web. Let me tell you about Charlotte's Web because they've told you a little bit about it. Greta's been taking it since November. I know a little bit about it. Okay? It is a high CBD, and CBD is the good part of the marijuana plant, and a very low THC. It still has THC in it. It is just extremely low. It is a 30-to-1 ratio that Greta is taking right now. She does not get stoned. She does not get a high. The Stanley brothers in Colorado, who basically have created this plant by genetically altering the plant, said that any adult would have to smoke a telephone pole's worth of that Charlotte's Web in order to get high. You've got to like marijuana a lot to do that. That's crazy. Greta could drink her entire month's worth of medical marijuana, of the CW, and get a stomach ache before she'd get a high. This is so not dangerous to our society. It's not. But it is so life-saving for our daughter. Last Thursday, now I've been out in Colorado with her from November 12th until about 4 weeks ago. Right, girls? Yeah, about 4 weeks ago. And now Mark is a farmer. He's a grain farmer in Clinton. And so he wanted to switch so he could spend some time with Greta, and then I could get to come home and spend time with Emma and Laura. So we swapped. Happily, we're going to go there and visit again tomorrow because these girls haven't seen their sister since Christmas. Mark called me last Thursday night. Now keep in mind, we had 12 to 15 of those horrible send the head to the ground seizures every day before Colorado. Mark called me on Thursday night and said, she only had one today. Nothing else has changed. Nothing else has changed other than her environment, which I doubt that is playing the biggest role, and adding this Charlotte's Web. Now, in addition to this, she went out there on 5 epilepsy medications that she took twice a day, in addition to loads more supplements and things like that. She is down. By this weekend, she will be only taking 1 of those epilepsy medications. You hear them talk about the side effects to these medications. You just look at the side effects to Depakote alone, to prednisone alone, to Onfi alone, and none of you sitting here would want to give that to your daughter. But we had to, because those were our choices. But this past August, our choices were to separate our family and go get something for Greta that we think will help her, or continue to let her seize 12 to 15 times a day. So we've separated our family, and this is not the way we want to live.
We love Minnesota. My husband farms in Minnesota. We live on the family farm. Our community and our family and friends is everything to us. Everybody misses G. Everyone misses her. And I miss being a family. So I just please ask, please consider this. I'm out in Colorado with 187 other families that are doing similar things to us. Currently, we have 187 children taking this medication. We also have 97 adults taking this. No one's getting stoned. What everyone is doing is having improved seizure activity. And that's really all a parent wants. Is there any questions I can answer for anyone?
Okay, right, Representative Grunhagen.
Thank you, Madam Chair. Just real quickly, thanks for your testimony. I hope things continue to work out for you. How is that administered to Greta?
Thank you for asking. Maria.
Bodker, right,
Yeah.
right.
Yes.
Yes.
And that's Botker, I think
Oh,
that was.
Bodker,
Yep.
okay, thank you.
So what I do, the medication, this Charlotte's Web, is a dried form of this specialized marijuana plant that is mixed with either an olive oil or a coconut oil. And so what it comes in an oil, just in a medication bottle, just a liquid medication bottle, just like amoxicillin would come in. Okay? And what I do is draw up a syringe to measure it 3 times a day, and I actually put it in Greta's food, mix it in with food, and she swallows it down. There is different absorption rates depending on how you take it, which we have been discussing that a little bit. But Greta really doesn't like the taste of it. And so I kind of need to hide it in food for her. Now, you also have the choice of putting it in an empty gel cap, and then you can administer as a pill, which Greta's used to taking countless numbers of pills every day. So she took that well, but the absorption rate is significantly less if it goes through the digestive system than if it absorbs into her mouth and into her blood system quicker.
Okay.
Is there one thing I can add also? Is that I want you to understand the process. We didn't just decide to go to Colorado and she gets access to this. I really think it's important for this committee to understand the process that she went through. We went to Colorado as soon as we knew we had made the decision, and we went to establish residency. We purchased a house there. Then we had to have Greta see 2 different physicians, and they had to examine whether she qualified. We had to fill out and notarize a red card application and send that into public health. We waited 52 days to get that, and then we also had to be approved to be on the waiting list for Greta. So it really is quite a process to go through to get access to it, and I think that works well in Colorado.
All right, well, thank you very much for your testimony, and thanks to the 2 girls that have been so patient sitting here.
I was hoping somebody would fire a question at them.
Emma and Laura. So, thank you. Okay, next we've got Tim Majerus. And, let me just say that the testimony we've heard so far is really compelling, but if each person takes that long, we're going to be here till tomorrow morning. So I'm going to ask people, even though I know everyone has a very compelling story, to please give it to us in just 2 or 3 minutes. And, I don't know, what each person wants to tell us about, but we're going to just have to ask everybody to move along a little quicker. Thank you. Welcome to the committee.
Thank you. Good evening, Madam Chair and members of the committee. My name is Timothy Majerus, and I appreciate the opportunity to speak in support of the medical marijuana bill today, not only for the chronic and terminally ill, but also for the military veterans of this great state who also greatly suffer as a result of their military service. I am a military officer, a former college professor in psychology, and a former Lutheran pastor. For the last 14 years, I've worked as a therapist specializing in substance abuse, domestic violence, and post-traumatic stress disorder. I first came face-to-face with medical marijuana as a Lutheran pastor when I was working with several terminally ill people from my congregation. Most, if not all, of those people were prescribed narcotics and benzodiazepines, not only to deal with their chronic pain, but also their end-of-life anxieties. Unfortunately, those patients who were prescribed those medications tended to exhibit many signs of withdrawal and cravings for those substances, as those substances are physically addicting. Some of the patients in the hospice care that I dealt with, however, chose to violate the law and use medical marijuana. Those patients all seemed to feel better as their nausea was greatly reduced and their appetites were actually heightened. At the same time, they each seemed to be more at ease with their end-of-life anxieties. Those patients didn't seem to exhibit signs of withdrawal. They all seemed to be much better adjusted. As a therapist for the last 14 years, dealing with addictions, domestic violence, post-traumatic stress, I've dealt with many veterans throughout the Minnesota Northland area. Many of those folks, too, were also prescribed narcotics for their chronic pain and benzodiazepines for their post-traumatic stress. Both of those substances, once again, are physically addicting. Some of those veterans have actually chose to supplement their medications with alcohol, and as you know, alcohol, too, is a physically addicting substance. I don't think I really need to go into the dangers associated with alcoholism. Some of the veterans I've worked with have actually supplemented, if not altogether replaced, their medications with marijuana, knowing very well that it's illegal. Interestingly, those veterans all seem to be doing extremely well. They're well adjusted. They're not getting into incidents such as domestic violence. They know their limitations. They're very, very well adjusted. I also stated that I, too, am a military officer. As a military officer, I, too, deal with problems associated with my own service. It was rather hard listening to Dr. Sue Sisley. I appreciate her coming from Arizona. I was involved in a terror attack years ago. I stood about 100 feet away from a car bombing that left many mothers bloodied, many children bloodied. It left me on the ground for quite a while. When I was able to get up off the ground, I realized that my right ear was blown out and part of my face was injured as a result. I, too, have been prescribed narcotics for pain, benzodiazepines for post-traumatic stress, several other medications to help me fall asleep and to stay asleep. Although I've seen veterans use medical marijuana and I know how beneficial it can be, I've chosen not to violate the law. It just literally goes against my core value to violate the law at this point in time. I cannot do that. I tend to cope with the physically addicting narcotics, the benzodiazepines, and like I said, the other several medications. And I continue to go to therapy at least twice a month, if not more. I deal a great deal with the Veterans Administration. At this point in my career, I'm wondering why Minnesota has turned its back not only on the terminally ill, but also the many veterans across this great state who have paid the price for the freedoms that we all enjoy. I'm wondering why my state wants to continue to criminalize the use and possession of a substance that is proven to be effective and relatively safe. I ask that you please consider the recent comments of CNN's chief medical correspondent, neurosurgeon Sanjay Gupta, who said that not only can marijuana work, but it can work when nothing else does. I also urge you to take a look at Dr. Oz. Many of you, I'm sure, know Dr. Oz from watching TV. He, too, widely supports the use of medical marijuana. I'm asking you today to consider adding medical marijuana to the tools for not only the sick and the chronically ill in our state, but the veterans who need this substance to help them cope with everyday life. You already heard Dr. Sisley talk about the many suicides across this country. So once again, I'm not only advocating for myself, I'm advocating for the many veterans across this great state. Not necessarily just as Lutheran pastor, not necessarily as a clinician, but once again, as a military veteran who served this country. I appreciate you listening to me tonight, and I'm open for questions if need be.
All right, thank you very much.
Thank you.
Jairus. I'm not seeing any questions, so I think we'll move along. Thank you.
Thank you very much.
Okay, Todd Mitchell. And after Todd Mitchell is Mary Ann Nelson and then Bernie Hess. And again, please, if people can kind of make their testimony a little more compact, it would be very helpful. And everybody who's been here, you know, we want to hear your stories, but if we can kind of not repeat what other people have said, it would be great. Thank you. Welcome to the committee.
Good evening, Madam Chair and committee members. Thank you very much for hearing my testimony today. My name is Todd Mitchell. I am in favor of this bill. I'm a 46-year-old father of two. I have a background that would, you might think, make it unlikely for me to be a medical marijuana patient. I am a conservative Christian. Most people would probably call me a fundamentalist. And a lifelong Republican, too. I have consistently preferred mainstream medicine, but suffering and medical marijuana cut across such philosophical, cultural, and political boundaries. In fact, at our GOP caucus in our precinct last month in Canby, we passed a resolution in support of medical marijuana. I met my wife of 26 years in the Civil Air Patrol. She went on to serve 23 years active duty in the military, while I became a police officer for the city of Fridley after earning my bachelor's degree in chemistry while at the U of M. While at Fridley PD, I went on to earn my MBA from the Carlson School of Management and to graduate from the Northwestern University Traffic Institute School of Police Staff and Command. After 10 years as a cop, I left the force to become a programmer. 2 years later, I quit to attend a fundamentalist Baptist seminary full-time here in the Twin Cities. After earning my Master of Divinity, I accepted the call to become a Baptist pastor in western Minnesota, where for 7 years I served the congregation and the surrounding community by preaching and teaching, counseling, ministering in the local jail, and volunteering for the local hospice program until retiring last June for reasons of health. In 2010, I suffered severe herniations of multiple discs in my lumbar spine. After a week in the hospital, doped up on Dilaudid, I underwent surgery here in the Twin Cities. That helped a lot. It got me back up on my feet. I was, however, left with nerve damage in my left foot that continues to this day, and more significantly, sciatic pain that gradually got worse. This is a common story. Soon I was taking 2 oxycodone pills every day, but even that did not keep up with the pain. I was afraid of this narcotic. Not only did I fear addiction, I also feared the side effects, especially after a physician told me that oxycodone would eventually lower my pain tolerance. I saw this was going in the wrong direction. I felt trapped between the excruciating pain that frequently kept me flat on my back and a drug, oxycodone, that seemed to be slowly taking my life away. Tylenol is not a good option since I have mild liver damage, very possibly from Tylenol that I used when I suffered back pain as a cop. Ibuprofen and naproxen are bad choices since I suffer from GERD. In 2012, I began researching alternatives. I learned about the benefits of medical marijuana, and to my surprise, its remarkably benign side effects by the accounts that I read. When I finally made the extraordinarily difficult decision to try a tiny bit of it in October of 2012, I was surprised by how well it helped me with my pain. It did not make my pain go away so much as it helped put it in perspective. It reduced my pain, yes, but it also helped me to push through the pain that remained. And it was easy. I quickly learned how to titrate the amount of marijuana that I used, obtaining pain relief without becoming intoxicating or otherwise interfering with my productivity. In 2013, I bought a fixer-upper of a house that demanded more physical exertion than I could have imagined a year before. Thanks to marijuana, I was able to get the job done. If you think that marijuana always makes you lazy, come and watch one of us work. You should have seen me working my heart out last summer on that house. When the lion's share of the work was done and we moved in, I knew the time had come to get off of oxycodone. I quit cold turkey. Marijuana not only picked up the slack with the pain, but helped me with the withdrawal. Now I use it exclusively to manage my back pain. Ever since switching from oxycodone to marijuana, I feel like I'm getting my life back. I have discovered what many others already know from firsthand experience, that marijuana is an excellent gateway drug to get off the hard drugs that our doctors are forced to prescribe here in Minnesota. Ironically, when I shared all this with my doctor, he immediately offered me Marinol. I had read about Marinol. It's pure THC, or synthetic water-soluble molecule. By all accounts I've read, however, Marinol would stone me out of my mind, sapping my productivity. No, thank you. But by offering me Marinol, he confirmed what I had already learned, that marijuana is medically valuable and belongs in our doctor's arsenal. I understand that some spokesmen for law enforcement are opposed to this bill. That is no surprise. As a veteran of the drug war myself, I know how much it is a part of a police officer's identity. But the valiant soldier who has spilled his blood is not always the right one to ask about giving up an inch of the ground for which he has fought so long and so hard. For that, we need decision makers like you, and I hope Governor Dayton, who can see the big picture. Please pass this bill. As it stands right now, I have no control over the quality of what I am buying. The only way right now for me to know for sure what I'm using would be to grow it myself. I don't dare do that. Even if it's just for my own medicine, that is equated to dealing, a felony. I'm caught between a rock and a hard place, and I'm begging you to make the right decision and rescue me from this intolerable situation. Please pass this bill. Make it legal for responsible, hardworking patients like me to use this medicine that is so helpful and so much less harmful than the hard drugs my doctors were forced to give me. Even, I dare say, less harmful than Tylenol that I was on. Have compassion on patients like me who could benefit so much from a well-regulated system that would assure the quality of our medicine and that would rescue us from the black market. Thank you again, Madam Chair, and committee members for hearing my testimony today.
Thank you, Mr. Mitchell. And okay, we have a question?
Yes, Madam Chair, I was just going to ask him
Yeah.
how you ingest it.
Yeah.
I prefer vaporizing, but I can't afford a vaporizer. I have a very small one that I love, but it's just not up to the task. Your tolerance does go up, so to get enough of a dose takes me so long with this little itty-bitty handheld vaporizer I have that I have resorted to smoking it. The most that I used was during that period when I was getting off of oxycodone, and I did develop a bit of a cough, to be honest with you, during those 3 weeks or so of heavy use, and that went away. But absolutely, I prefer vaporizing for all sorts of reasons, and the health of my lungs first and foremost. When I can finally afford a good one, that's what I'm going to buy.
Thank you very much. Thank you, Representative Schoen. I was going to ask the exact same thing, so appreciate that. Okay, thank you. Next, we have Mary Ann Nelson, then Bernie Hess, then Michael Studer, then Randy Quast. So, welcome. Thank you for sticking it out. I don't think it's been too easy.
Madam Chair, Committee, thank you for listening. I'm not going to repeat what you've just heard. Oh, yep. Sorry, Mary Ann Nelson from Mankato, Minnesota.
Go ahead, please.
I'm not going to repeat the stories that you've heard from the other families today because my story sounds much the same as theirs. Born beautiful baby, things are going great. All of a sudden you start having seizures. What the heck is this going on? You take them to the doctor. Doctor says, try this medication. Nope, that doesn't work. Try this one. Nope, that doesn't work. You try them all. We've tried them all. Then we go into the surgeries. Yep, she's got a vagus nerve stimulator implanted into her chest, goes up to her brain. We had the discussion on brain surgery. Not going to do it. My daughter is 11 years old. She has full cognitive abilities. She is in a regular classroom setting in Lake Crystal. She is not taken out for special ed. Her brain works just like everybody else's brain, except for we have seizures. And we have the pages and pages and pages of seizures. And I'm hoping those other families aren't behind me tonight when I tell them that for my daughter, those seizures just got worse. It is not unlikely for Rachel to have a seizure that is 15, 20 minutes at length. About a month ago, she had a seizure that was an hour long, and I'm calling the ambulance to come get her because I got to get some oxygen on her, and we're going to have to airlift her from Mankato 2 blocks down over to Gillette. And when they do that for Rachel, they get her to the hospital, and the emergency room doctor doesn't get to touch my daughter because he is standing there with a room of 12 people orchestrating to each one of them what they need to do for her because one person has to have control of that room. I am standing next to that emergency room doctor trying to give him as much information as I possibly can because my daughter's not breathing. They then need to put a tube down my daughter's throat because her left lung has now collapsed because of this seizure. It's probably an hour, hour and a half into this. Then they call the chaplain in, and she stands next to me because when they tell me that they're going to tube my daughter, they know that they airlift her up here. My other 2 children are going to be at home without their mother for the next 7 to 10 days, and that this might not be the time that she makes it. I don't know what else to do. We have taken every medication. We've done the procedures. We've done the diet. I then hear about the CBD, the chemical that other people with seizures are using in Colorado. I don't want to move to Colorado. I don't want to move half my family. I don't want to do that, and I won't do. If I have to, I will, because as a mother, that's what I will do. I ask you guys to put together what you need to get this thing passed. Tell me what I need to do. If I need to go to law enforcement, if I need to get onto the campaign, I need to do that because I need to keep her healthy and I need to keep my family healthy. Thank you.
Thank you very much. Questions from members? Okay. Thank you so much. Have a safe drive home. Bernie Hess? Then we've got Michael Studer, Randy Quast, John Ramsey. Welcome to the committee.
Thank you. Madam Chair, with your permission, I'd like to hand this off to our point person on this. It's T.J. Lawrenson. He'll be very brief and to the point.
Okay. Welcome to the committee.
Thank you, Madam Chair. I'm with the United Food and Commercial Workers International Union.
And your name, I'm sorry?
T.J. Lawrenson.
Okay, thank you. Mr. Lawrenson, go ahead.
We are currently, we represent cannabis workers throughout the United States, 6 states in the District of Columbia. We've been working with different states and municipalities on ways to regulate so that the the product doesn't get out to unintended folks. So, I'm here to say that we will offer ourselves with industry and with regulatory people to help to make sure that a regulatory framework is put together that doesn't allow people that aren't patients to get the product, to get, and it's been working very successfully in places where we've jumped in and worked with law enforcement and worked with the different agencies and legislators to make something that everybody can, in 2014, we can surely find a way to compassionately get medicine to patients without it leaking to our streets and our communities. And, I applaud the efforts that you have here today and would offer any assistance the UFCW can give to make sure that patients can get their medicine and yet children and other community people aren't harmed by it.
Thank you very much for your testimony. I hope that if the bill makes it out of here tonight and goes to other committees, I think your testimony probably would be great in some of those other places like
Right.
public safety, where they'll be talking more about how to get that.
And one of the things that part of the committee today is talking about is the health, and I'm hearing people come up and talk about self-medicating of cannabis that they're acquiring here in Minnesota that could be or could not be from cartels that are spraying cannabis down with pesticides that are very, very harmful, especially for patients who are undergoing chemotherapy and treating themselves for cancer. So if you're ingesting pesticides from a black market or a cartel, it's very, very harmful to the patients in Minnesota, and it does need to be controlled and regulated, and patients do need to know that they can get safe access to a drug or to their medicine that's safe.
Okay, thank you so much. Michael Studer, Randy Cross, John Ramsey, Leslie Davis. Welcome to the committee.
Well, thank you, Madam Chairman and the committee. Appreciate being here. I'm a little bit late to the party as an organization. I'm representing a group called the Acupuncturists as Medical Marijuana Providers. And it's probably, first of all, I want to say the stories and the people testimony today, I just want to applaud everyone, and I know that that's not the protocol, but I'll verbalize it if I can. And I'd also like to say that those who are afraid, I read this, somebody wrote this, and I thought it was interesting. Those who are afraid of cannabis because of cultural stigma are missing a huge opportunity to educate and genuinely help and heal people. So why are acupuncturists, why should they be a medical marijuana provider? Well, we're licensed. And we're licensed by the Board of Medical Practice, which is the same group that is the provider section, licenses physicians and physicians' assistants. We're authorized by our Practice Act, Statute 147B, to prescribe herbal medicines and herbal patent pharmaceuticals. We have a long 2,200-year history that parallels cannabis and acupuncture in folk medicine and in the agricultural history of China. The Shen is a text that was compiled in 1 AD or 1 BCE, and it's considered to be the world's oldest pharmacopoeia, and it recommends marijuana for more than 100 ailments. Cannabis is one of the 50 fundamental herbs in the traditional Chinese medicine pharmacopoeia, and this is what brought me to this committee. I read this just recently, and I thought and it deals with a couple of other pieces that have been introduced here just a while back. China is poised to become the world's leader in advanced cannabis pharmaceutical development and in marketing. In the World Intellectual Property Office filings, China has received 319 patents for medical cannabis use, development, and to market products based on, and I'm in looking at all of my other works with and dealings with Chinese medicine. They will be using traditional Chinese medicine principles as a form of investigation and for their syndromes and symptoms and their therapeutics and their dosages. Licensed acupuncturists are the only traditional Chinese medicine educated and trained professional medical group qualified to bring Dhamma or cannabis back to its historically correct and consistent medical usages through a proven herbal medical system of traditional Chinese medicine. And we are the only educated and skilled practitioners who know how to use the TCM advanced-based cannabis pharmaceuticals that will benefit Minnesotans.
Okay, Mr. Studer, let me just stop you for a second. So you understand that in this bill that's before us,
Yes.
there are no acupuncturists in it, and I
Yes.
assume that you're here because you think that acupuncturists should be added?
I'm asking
Okay.
that as an
Okay.
addition to the
Okay,
bill.
well, let me just say that I think that the more appropriate forum for that would be to see if we're not going to be able to do that tonight.
Okay.
And I think that probably if the bill gets out of committee tonight, I think the author would be glad to talk with you about that.
Okay.
And that would probably be better offline rather than using more of the committee's time for this tonight. So I appreciate your being here. I think the handout is good, and I think we've heard your message, but I
Okay.
think we need to move on.
Thank you.
Thank you very much.
If I could just add one piece to that.
Sure.
Because we are skilled and knowledgeable in the TCM, what will be coming out of China in the future, we will be able to address the safety and the quality and the other issues that some people have expressed the most recent,
Okay.
about the pot being in non-usable state for most
Okay.
people.
All right.
So thank you very much.
Thank you very much. Okay, Randy Quast, and then John Ramsey, Leslie Davis, and then Dr. Lindsay Pearson. Welcome to the committee.
Thank you, Madam Chair, committee. My name is Randy Quast, and I live in Minneapolis. I'm a Minneapolis resident, father of 4 adult children. I'm a successful business owner, now retired. I sold my company. But I'm also the executive director of Minnesota Normal. Minnesota Normal is a nonprofit 501c4 grassroots lobbying organization. We incorporated in Minnesota in January of 2011, so we're just about 3 years old. We are also the statewide affiliate of NORML, which NORML, N-O-R-M-L, is the National Organization for the Reform of Marijuana Laws. Our mission is to repeal cannabis prohibition laws so that all adult uses are no longer subject to penalty. I realize that this hearing here is related to the health side of it, and I'm here to testify in support of House File 1818. I mean, Minnesota Normal believes it's safe for all adults, and so for at least 6, we think first people that ought to have access to marijuana are those with a medical need. We also think, though, the best way to accomplish that is to make it legal for everybody. It is objectively safer than alcohol and tobacco, which is sold at stores.
Well, Mr. Quast, that's not on the table here tonight, and our time is very limited. So if you could just...
I'll just call out some things. I think some studies that have not been pointed out that I can refer to is that, one thing it's said that it's not studied enough. We don't know enough about marijuana. But you can do a PubMed search. To date, there's over 22,000 studies. If you just did a search on marijuana on the government's PubMed site, the majority of them in favor of the medical efficacy for marijuana. There's a famous study, we hear a lot about smoking versus vaporizing. There's a famous study funded by NIDA, who we all heard is so hard to get money. Again, NIDA would only fund the study if they were looking for something bad. And so they funded, it was the largest case-controlled study ever conducted to investigate the respiratory effects of marijuana and cigarette smoking. And the study concluded that marijuana smoking was not associated with the risk of developing lung cancer. And surprisingly, researchers found that people who smoked marijuana actually had a lower incidence of cancer compared to non-users. In fact, some researchers have reported a possible protective effect from marijuana against lung cancer. So that's a Donald Tashkin by the UCLA that came out in 2006. And there's other, I won't go into a lot of them, but we can name study after study where it's, I mean, it is so clear that it has medicinal value. Now, in a way, it's a shame that our lawmakers here have to decide whether it does have medical value, but unfortunately, our law, the specialist is normally the Board of Pharmacy. I mean, they are dealing with, I can't even pronounce all of the chemicals that they look at and so on. But Minnesota varied from the Controlled Substances Act a couple of years ago with the Omnibus Drug Bill Act. And it used to be, if you thought marijuana had a medicinal value, you could petition the Board of Pharmacy, and they would have hearings. But that administrative process is no longer available to us. So if you wanted to petition and show the case, Minnesota is one of the few states where there is no administrative process. So it does have to come from the lawmakers. And so I just urge you, I mean, I heard a good analogy once. Keep in mind we're talking about a substance that's less dangerous than beer. It's less risky than children's cough syrup and about as addictive as caffeine. And so it's a non-toxic herb, and we're selling much more deadly things at our local convenience store. So I just really encourage medicinal use. It's almost a given. So thanks.
All right, thank you. Okay, Mr. Ramsey, John Ramsey.
Madam Chair, maybe using the old trick of reading all the names on the list so we know how many we still have to get through.
Yeah, thank you, Representative
Appropriate.
Melin. So here's who we've got: John Ramsey, Leslie Davis, Dr. Lindsay Pearson, Cian Patrice Becker, Laura Marie Becker, Jonathan Holmgren, Autumn Leva, Thomas Evenstad, Michelle Gran, and another person whose name I can't read here, Keith Gronhouds. So that's who's on the list. So quite a few folks still, and it is 10 after 8. So if you all can kind of compress your testimony, we would appreciate it. Welcome to the committee.
Thank you. Thank you, Madam Chair and committee. My name's John Ramsey. It's nice to be back in Minnesota after 11 and a half years living next door down in Iowa, working. 2005, I drove myself to Mercy Capital. Down in Iowa, I had a severe headache. Never had a headache like that before. Went into emergency, asked if I had insurance. Said, yeah, work insurance. She started taking my blood pressure and asked me if I was on methamphetamines, and I didn't know what that was. And she had told me, and I says, no, I don't do drugs. So she said she'd be right back. Next thing I knew, I woke up. They asked me if I knew where I was. I said, yeah, I just drove myself to Mercy Capital. I was unaware they had medevaced me down to Iowa City. I had a brain aneurysm. They had me strapped in the bed, and they were asking me if I knew who the president was for that year, da-da-da-da-da. Well, to make a long story short, I spent 9 days in the hospital doing different tests. I left, I think it was right before Valentine's Day in February or right after. Took a Greyhound back up to Des Moines because I had just moved down there, didn't know too many people. Had to go find a general practitioner because I had never been sick before. So to make a long story short, months afterwards, they were sending me to all these specialists because I still had severe headaches. I wasn't eating. I wasn't sleeping. So they were running tests on me. They wanted me to go to a pain clinic, and I asked, well, what does the pain clinic do? And what I gathered from it, they wanted to put me on pain pills, and I said, well, that's not going to, to me that wasn't going to help. I didn't even do cough syrup back then. I tried to stay away from all the over-the-counter stuff. I wasn't going for it. So I had my headaches for a long time. They got worse. I wasn't back to work yet. I had talked to some friends because she had told me that her father had some extra medical marijuana that he had, and this was back in 2005, and her father had died of cancer, but he was smoking marijuana after he had his treatments, but he had passed away, and they still had the marijuana, so I said, all right, I says, I'll see what, I'll try it. I was kind of nervous because, I don't have a police record, never did. I was a little nervous about that. So to make a long story short, I started smoking marijuana. I started getting my appetite back, I'd say probably within a month. This was, like I said, back in 2005. I still have short and long-term memory on and off. I started eating again. I don't know how long after that, but I ended up going back to work, starting off at 2 days at a time, per week. 3 days, and I don't recollect the time, but I ended up back to 40 hours a weekend working overtime. So all I wanted to say was they had me on different medications for my blood pressure. Don't know why my blood pressure was up. Don't know why I had headaches, because when I went down to Iowa, I was healthy as a horse, worked out at the gym. I thought I ate pretty healthy, even though, still I had meat and potatoes, but I just figured, that's the only thing that helped me out, as far as I'm concerned, to get me back, to get me away from the nausea, got me eating, got me sleeping, it got me healthy again, and I just figured, it's something that if it can help me, and, these other people out there, their children, other people, as far as cancer, and I don't know what the liabilities are or anything like that, but I'm just here to say, it's something that really should be looked at, instead of it's taboo or whatever, I was just talking to people earlier. I remember years ago watching Reefer Madness, all the scare tactics that follow marijuana, and it's just like, what, if it's helpful, it should be legal. That's all I have to say. Quick story, but it helped me out. I'm healthy. I'm still on blood pressure medication. I'm a little bit on heart medication. I still carry my nitro with me, but I'm a lot better off than I was back in 2005, 2006, and 2007, so I'm thankful that it was there. It was available.
Thank you. Questions for members? Okay, not seeing any. Thank you very much, Mr. Ramsey.
Oh, you're welcome.
Okay, Leslie Davis, then Dr. Lindsay Pearson, then Cian Patrice Becker. Welcome to the committee.
Thank you, Madam Chair, members of the committee. I'm Leslie Davis. Until I tore the meniscus in my knee, I didn't know what meniscus was. I thought it was going to be something that we need to make illegal. But I'm the president and founder of the Earth Protector Environmental Group. I'm the manager of the No Fluoride Minnesota campaign. And boy, you want to talk about a poison. You could talk about fluoride in
We're not
water.
here to talk about that, Mr. Davis. We're here to talk about marijuana as a medicine.
Yeah, well, I'm going to get to that in a minute. I'm going to highlight some of the points that I have. And I'm also running for governor in the DFL party, and I'm registered, and I'll be in the primary on August 12th. So those people that want an option
We're not here to
will
talk
have
about that either.
The creator of everything gave us a wonderful plant called cannabis, or marijuana. And it provides food and fuel and fiber and drugs. And some of these medicines are very helpful in relieving pain for a lot of people. But what business is it of ours to interfere with a plant that was provided to us by the Creator? And we should be able to do whatever we want with it, whether it's smoke it, eat it, or cook it, or whatever. This is not a drug. Cannabis is not a drug. It's a plant. I guess you could take lots of things, and synthesize it down and make all kinds of other products of it. But This is a liberty issue also. But I've seen firsthand how it helps a lot of people that have a lot of problems, whether they're emotional or psychological. And this is going to move forward. You know, there's a tsunami coming over America that's going to come from Minnesota of freedom, because people are fed up with all these restrictions and high taxes, and you can't smoke this and you can't eat that. But it's okay for us to feed the children tons of high fructose corn syrup.
Mr. Davis, you're way off topic, and we are really late. Could you just stick to the topic and just please finish up?
Well, we're talking about health.
Well, we're talking about we're talking about a particular bill that's before the committee. This is a health committee, but we're not talking about every health topic tonight, only a bill that's before the committee.
Okay. So passing this bill will help people that are in pain or suffering from various other illnesses, and there is nothing wrong if somebody wants to use it to get a buzz or to get high. Absolutely nothing wrong with that. A lot of people that oppose medical marijuana have cabinets full of liquor and refrigerators full of beer. So I would support this bill. I ask you to pass it, and I guarantee you that when this bill gets to Governor Dayton's desk, he'll sign it, because he knows I'm breathing down his neck, and if he doesn't sign this medical marijuana bill, I'm going to knock him right out of the box. So thanks a lot for your patience.
Thank you
and you all
very
have
much.
a good night. More to come when we deal with the cops, the goons with the guns, and the bums with the badges. We'll deal with
that
them
in another
at other
committee.
committees.
Thank you.
Thanks a lot.
Dr. Lindsay Pearson.
You all have a good night.
Welcome to the committee.
Thank you, Madam Chair. Honorable committee members, my name is Dr. Lindsay Pearson, and I'm a physician licensed to practice medicine in the state of Arizona. Where I've worked with within the medical marijuana program for the last 4 years. I've certified patients, I've worked with patients. So I'm here today to testify on the merits and the safety of medical marijuana. So just to give you the bullet. 2013 NIH, the National Institutes of Health, said, due to research they found that we found the cure for breast cancer, colon cancer, and lung cancer. We've also found that it is, medical marijuana is useful in degenerative diseases such as MS, epilepsy, seizures. And I've seen this firsthand working with patients. And I've seen the reduction of side effects due to narcotics and anti-epileptics. I've seen people get off of all of their oxycodone and hydromorphone, the morphine derivatives. That really damages the quality of life. As a physician, my oath was to first do no harm. So before I went on this endeavor of learning about medical marijuana and working with patients, I did my research, and currently I'm writing a book on medical marijuana. There's, you heard all these stories, but as a physician firsthand in a state where this bill proposed here in Minnesota has all the strengths of the Arizona system plus some extra benefits because they've seen the groundwork in other states. There's no other drugs out there that can do what medical marijuana does without the negative side effects. I've revived, given mouth-to-mouth cardiac pumps to too many people out in public that were on oxycodone mixed with soma and alcohol. I'm tired of watching patients die. I really am. And as a physician, I'm here. I'm a resource. So, I implore you to, use us physicians that have been in there, ask questions during this process, because there's plenty of benefits out there, and people have touched on them. So there's not much more than I can say, except for...
I have a question for you, Dr. Pearson.
Yes,
in
ma'am.
Arizona, is there a split among physicians about the utility of this medication? Or was there before, and what is the feeling now?
There is. And I felt marginalized when I first became, seeing patients to do the certifications. However, when I saw the effects, I don't care what people think. They can call me a quack. And the doctors who are seeing this, like specialists that I'm referring patients back to their neurologists, they can't explain it. A lot of them have, went to medical school before medical marijuana became a household word. And, it's ingrained in their head along with law enforcement that marijuana is bad. And I have to say, in Arizona, I've also seen spouses of DEA agents, Border Patrol, ICE agents. They've brought their spouses to my clinic to look for another alternative versus the prescription drugs that they're on that aren't helping. So when these law enforcement members bring their spouses to me and entrust me with their care, that means something to me, especially since they are the front line on the war on drugs. But they see the benefit of medical marijuana, and through their action of coming to me, it speaks tons.
Okay, Representative Melin.
Yes, Madam Chair, I just wanted to note that we have 2 physicians from Arizona here, and they willingly left Arizona to come to Minnesota to testify on this bill. So I think that alone shows their passion on this issue.
Yes,
Most of us
indeed.
probably wish we could relocate to Arizona right about now.
Yes.
Have a hearing in Arizona.
Yes, thank you, and our committee budget just will not allow for that. Otherwise, we would definitely try to do it. Representative Huntley, did you?
Well, Madam Chair and Dr. Pearson, what was the temperature in Arizona when you left there?
Well, actually, I've been back here for the past 9 months working on a book, so I truly miss Arizona right now.
Okay, Representative Albright.
Thank you, Madam Chair. For the doctor, I've heard from your counter peer, Dr. Sisley, and you now, and you're in the process of writing a book, and I would understand that from a medical background, you're looking at the data.
Correct.
At the factual pattern. Could you speak to the fact pattern that you have discerned from your research or from your patients?
Sure.
Sure, and Dr. Pearson, go ahead.
I'm sorry, Chairman. Fact, we have an endocannabinoid system. Mothers pass THC-like substances to babies through the breast milk. It's for normal development and for babies to thrive. Like someone said earlier, there's 20,000 papers on medical marijuana. And some of them, not all of them, are pure double-blind placebo studies, but there's a bunch of empirical studies. So what I found is it's never killed anyone. Marijuana has never killed anyone. You can't say that about any other drug. The only time that people say that marijuana kills is when it's combined with alcohol or other substances. But marijuana, in its 10,000 recorded history that we have historically, no one has ever died. And I think that speaks volumes right there. The studies show, statistically significant that participants in these studies get relief. It does what Remicade and Humira does for autoimmune diseases, but without suppressing the immune system. It decreases the TNF-alpha that causes the disease, but it doesn't suppress the immune system, and these people and these patients don't develop the lung cancer and subsequent infections from those drugs. And just in my personal experience, I've seen lives change. People get off, I have patients taking over 300 milligrams of oxycodone a day. I don't know how they tolerate it, but their pain specialists do it, but they're numb to the world. The quality of life is horrible. So to see the spark come back into the eyes, families change because oxycodone and the opioids tear apart families. The addiction is so great. The addiction and the withdrawal of marijuana is far less of caffeine and nicotine. There's plenty of studies that show this, that the withdrawal effects of marijuana are similar to that of Zoloft, 2 to 3 days, not like having to go on Suboxone or other opioid type of a regimen to get off. So, there's plenty of data out there, and it does show in different studies. Some have 16 members, some have 237. So you have to look at the studies. But all 20,000 put together really does form a good argument for the efficacy of medical marijuana.
Representative Albright.
Thank you, Madam Chair. Why write a book as opposed to subject your findings to a peer-reviewed journal?
Well, Dr. Pearson.
Thank you. The book is entitled Medical Marijuana for the Physician and Patient Keeping It Medical. It's a book designed to create a dialogue between patients and physicians. Because in medical marijuana states, I implore physicians to not just certify patients. Don't just give them the certification to go out and use medical marijuana, but work with them. We heard about CBDs that work well with seizures. Well, there's other forms that work with other conditions, and doctors need to be educated in doing this, and patients need to know how to converse with the doctor.
Representative Albright.
Thank you, Madam Chair. Your familiarity with the Arizona law, as it would compare or contrast, you mentioned that in light of what the Arizona law includes and how the bill before us is structured. You said that it is like the Arizona law with some additional benefits. Could you speak to those additional benefits and compare and contrast how this bill is stronger, better, or weaker than the one in Arizona?
Dr. Pearson.
It has my main objective is safety for patients. So, the physician monitoring is great. The allowable, okay, we'll start with the beginning here. The allowable amount, everything is logical, in this bill. It provides safety nets and doctor checks, so patients aren't falling through the system, so doctors aren't just writing certifications left and right for patients. So to keep it medical. Right now, I'm sorry, I didn't make any notes on specifics.
Representative Albright?
I'll just finish then. If there was one thing that you would observe that isn't included in either the Arizona law or in the bill before us, what would you find that to be?
I found this law to be inclusive of everything good in the Arizona law, so I don't have any other comment on that.
Okay. Thank you.
Madam Chair, I would just add
Representative
to
Melin.
that point, Representative Albright, that in the amendment that Dr. Pearson probably hasn't had a chance to look at, but it actually was geared more towards the Arizona law. In Arizona, I believe you have to be originally my bill was if you were 15 miles away from a dispensary, you could cultivate marijuana. In Arizona, it's 25 miles. We actually changed it to 30 miles now, so we upped it a little bit, so you have to be even further away from a dispensary. And the last I heard, only 5% of patients in Arizona cultivate their own, because once you increase that distance, obviously most people are using a dispensary. So there are some facets that overlap with the bill and how Arizona administers their medical marijuana.
Okay, and a question from Representative Allen.
Thank you, Madam Chair. My question is about subdivision 11 of the bill, where we were talking about the difference between Arizona and this proposed bill. And so, the doctor's opinion, or maybe Dr. Sicily or the author, Representative Melin, to talk about under that provision for PTSD that only a psychiatrist can prescribe. And is that similar in Arizona? And could you talk about, there's a concern that that's going to delay treatment, and so if you could talk about that provision.
Dr. Pearson?
Well, in Arizona, PTSD is not a certifiable condition. It just went up in front of the medical board again, or the Department of Health, as a qualifying condition, and they said that, in their opinion, it wasn't a qualifying condition. So in Arizona, the veterans that I work with usually have some other comorbid condition like, pain, chronic pain or muscle spasms that, go along with it. But PTSD is not a certifiable condition in Arizona right now for medical marijuana.
Okay. Representative Allen? Okay. All right. Thank you very much, Dr. Pearson.
Thank you.
We'll move on here. We've got two people whose last name is Becker. And I don't know if they're together. Maybe they can come up together. And then after that, we've got Jonathan Holmgren. Give me another chair. And then Autumn Leva, and then Thomas Evenstad, Michelle Gran. Welcome to the committee. Please, whichever one or both are going to speak, please give your name and go ahead.
Good evening, Madam Chair and committee members. Thank you for the opportunity to share our thoughts with you today. My name is Sian Becker, and this is my wife, Laura.
I'm having a little trouble hearing you. I'm sorry. Maybe you need to pull the mic a bit closer. Oh, thank you.
Okay, I'll start over.
That's better.
Okay. Good evening, Madam Chair and committee members. Thank you for the opportunity to share our thoughts with you today. My name is Sian Becker, and this is my wife, Laura. We are here today to share with you why we feel legalizing medical marijuana is important to many Minnesotans, including myself, and to ask you to support HF 1818 and send it to the House floor for a vote. On August 11, 1998, I was diagnosed with multiple sclerosis. Over the years, that has progressed to the point that I can no longer work, and the debilitating effects that I suffer from every minute of every single day have deeply diminished my quality of life. I have researched the pros and cons of medical marijuana and firmly believe that having the option of using this to alleviate some of my pain could greatly improve my life. A few months ago, I was in another state that has legalized medical marijuana and had the opportunity to try a sample of some hard candy that had marijuana in it. That one night, for a few hours, I felt relief that I haven't felt in years. And we understand that Governor Dayton has stated that he will not sign a bill legalizing medical marijuana without the support of law enforcement. With all due respect, this is a health care issue. My health care decisions should be made by me and my doctors, not the governor and not law enforcement. Additionally, polls have consistently shown that the majority of Minnesotans support legalizing medical marijuana, even if the governor doesn't. If this bill passes both the House and the Senate, we believe the legislature should consider bringing it up as a constitutional amendment that we, the people, could vote on.
Welcome.
Thank you. When I first met CN almost 8
And I
years
do
ago...
need you to just give us your name, too, because we're
sorry.
taping.
My name is Laura Becker.
Thank you.
Thank you. When I first met CN almost 8 years ago, I knew she had multiple sclerosis. At that time, she was on a traditional method of treatment that did next to nothing for her. She has since moved on to the next most advanced type of treatment. Unfortunately, it doesn't seem to be helping much either. All day, every day, my wife battles heroically and without complaint through severe muscle spasms, pain that reaches every inch of her body, and tremors that won't stop. And that's just a few of the symptoms. In fact, she was also recently diagnosed by a neurologist as having a movement disorder. This neurologist also happens to support medical marijuana as a treatment for various neurological disorders. We know that medical marijuana has been indicated in the treatment of multiple sclerosis, as well as other diseases that have no cure. Isn't it time to give those who suffer a chance to benefit from it? I ask you to remember, we are talking about medical marijuana, and it is time to stop being afraid of it. The benefits of marijuana as a medical treatment have been studied, accepted, and proven in other states. We think Minnesota should be among those states. Today you have the opportunity to make a real difference in the lives of many Minnesotans. Your support will signify that we have indeed come a long way. Please support HF 1818 and send it to the House floor for a vote. Thank you.
All right, thank you very much. And just to be clear, we're not sending it to the House floor tonight. It will go to another committee if it passes out of this one. It's got a ways to travel.
But you would if you could, right?
Thank you. Jonathan Holmgren. Welcome to the committee.
Hi, thank you. Hi, everybody. My name is Jonathan Holmgren. I'm 32 years old. I'm a citizen of Spring Lake Park, Minnesota. For the past 4 years, I've been using cannabis, or what you guys call marijuana, for fighting Crohn's disease and 2 other autoimmune diseases that are attacking my spine. I also have a genetic mutation known as Ehlers-Danlos syndrome, which affects my connective tissues, which is basically my whole body. It further complicates my health. I'm unable to use pharmaceutical drugs due to the side effects on myself, and my use of cannabis and marijuana has been key in my treatment of pain, inflammation, and maintaining my life, liberty, and pursuit of happiness. Thank you for your time, and take care.
Thank you very much, Mr. Holmgren. I'm sure you've been waiting a long time to speak to us.
Thank you.
Autumn Leva? Welcome.
Thank you. Good evening, Madam Chairwoman and members of the committee. My name is Autumn Leva, and I am here representing Minnesota Family Council this evening. I think it's first instructive to look to Colorado, who first began using medical marijuana in 2001. And the medical marijuana registration program indicates that from 2001 to 2013, 94% of the reporting conditions for use of medical marijuana were for severe pain, not cancer, glaucoma, or AIDS. Other authorized conditions weren't even close, with muscle spasms coming in at a distant second place at 13%. So I think it's instructive to point out that if those statistics carry over to Minnesota, if this bill were to become law, Minnesota legislators would be authorizing for users overwhelmingly claiming severe pain the use of a highly addictive and unproven drug. And at the very least, this should cause pause for some serious concern. And that's why I'm here tonight, to point out 5 main concerns that we have with this bill. I will be succinct. The first is that marijuana is, as a gentle reminder, still illegal under federal law. Secondly, this bill is being sold as a help for the very sick and terminally ill patients, but many of the medical communities this bill is said to help don't even support the use of medical marijuana. To list just a few, American Cancer Society, Multiple Sclerosis Society, and the Tourette Syndrome Association Medical Advisory Board finds that studies are inconclusive to show positive effects of medical marijuana on Tourette's, and emphasizes the high degree of risks associated with the drug and the long-term effects.
Now, do you represent any of those organizations?
No, ma'am. This is research found right on their website.
Giving us a survey of websites.
Correct.
Okay.
And their position on the issue, yes. And finally, American Medical Association and American Academy of Pediatrics. The third point is this is still a highly addictive, mind-altering drug that the government has classified as having, quote, no medicinal uses and high risk for abuse. The list of risks associated with marijuana, according to the National Institute on Drug Abuse, is quite long, including mental health problems, lung disease, heart attack, harming brain development, and the list goes on. In fact, again, the NIDA states clinical evidence has not shown that the therapeutic benefits of marijuana outweigh its significant health risks. Point number 4, this authorization of medical marijuana makes a mockery of the drug approval and use process. So when we're prescribed an FDA-approved strong drug by a doctor, I think all of us have been there at some point, the container specifies the use of the drug, exactly how many to take and when, restrictions on refills, side effects, interaction with other drugs, how long to take it, warnings, etc. There's no warnings for the aforementioned serious health risks associated with marijuana on a marijuana plant. No warnings on a joint. It contains 4 times the amount of carbon monoxide and tar as a typical cigarette. And a patient's authorized 12 marijuana plants don't mention that marijuana is highly addictive. In fact, 4.5 million addicted in the U.S. today. And that its potency has risen steadily since the 80s. And that the FDA has approved THC as a medication, but it has not approved the marijuana plant because insufficient clinical trials to show that its benefits outweigh the risks. And to be considered a legitimate medicine, a substance must have well-defined and measurable ingredients that are consistent from one unit, such as a pill, to the next. And this consistency allows doctors to determine the dose and frequency. Obviously, a marijuana plant is different from that. And again, the significant health risks prevent it from being FDA authorized. And finally, and perhaps most importantly, this bill sends entirely the wrong message to our youth. According to the NIDA, quote, rising marijuana use reflects changing perceptions and attitudes. Historically, as perception of risks goes down, use goes up, and vice versa. Young people are showing less disapproval of marijuana use and decreased perception that marijuana is dangerous. The growing perception of marijuana as a safe drug may reflect recent public discussions over, quote, medical marijuana, and movements to legalize the drug for adult recreational use in some states. They also note that marijuana use by adolescents declined from the 90s till mid-2000s, but general use and daily use have increased since that time. So, you know, for marijuana for young people, which we know comes with significant risks, including a higher increased level of school dropout, this is a serious concern and a serious cause for concern in sending a message to our youth. So in conclusion, for a highly addictive drug with well-documented health risks as well as societal risks, including increases in crime, likelihood of school dropout and or career failure, poorer mental and physical health, and in relationship and bonding issues, and with leading associations representing those who suffer from the, quote, debilitating medical conditions listed in the bill, warning that the risks of marijuana use are outweighing any potential, though as of yet clinically unproven benefits, this committee ought to have serious pause before putting at risk the entire state, especially our youth, for a dangerous drug that the overwhelming majority of people would likely use for serious pain. So we at Minnesota Family Council urge the Health and Human Services Committee, a committee designed to be a legislative watchdog creating policies to benefit the health and well-being of the individuals and families in our state, to vote against passing this bill out of committee. Thank you.
All right, thank you, Ms. Leva. And I just want to invite you, if you're worried about highly addictive drugs with well-documented health risks, to stick around and hear our next bill and the lengths that we have to go to deal with the drugs that are available, which are being used to treat chronic, serious pain.
I'd be happy to. Thank you.
Okay. Thomas Evanstad. Unless anyone has questions. I didn't ask for questions for this witness. Okay. Thank you.
Thank you.
Welcome to the committee.
Welcome. Hi there. Nice to see everybody at the committee here. I'm Tom Evanstad, and I'm running for governor as well, and I'm here tonight to urge every person in the state to stand up for these sick children and these adults in Minnesota who can benefit from a plant that predates human civilization, has been smoked in various forms as medicine successfully for centuries, and stand with Representative Carly Melin and I against Minnesota law enforcement on this issue, whose self-serving financial motives Rep. Melin courageously smoked out and went national with the Washington Post article, can best be described as moral pollution. Marijuana's active ingredient, cannabinol, is present in all of our brains, as the doctors and researchers have been telling all of us. So I guess that means that the Rich Stanek and the law enforcement cartel in the state and the rest of us are all stoned. So why not assist and help sick people?
Mr. Evanstad, I'm sorry, but we're here to talk about the medical issues, not to blast law enforcement.
Aren't they the impediment to this whole thing?
Some of us
Okay.
may agree, but we're focusing on the medical issues here, please.
Okay, as far as the medical issues, the United States Department of Health and Human Services gave itself in 2003 the pot patent. And if anybody in this committee has looked at the patent, it is a medical patent. It is talking about cannabis as being the miracle drug, and it lists that cannabis is a neuroprotectant. It is an antioxidant. They have conditions in there from Alzheimer's all the way through stroke and PTSD. And I have PTSD, and I have migraines. So I have two different conditions that are medically allowed in many different states that have medical marijuana. And when I went to Denver after the first of the year and went out and experienced Denver, that was freedom. That was being able to go in and get medication. And I'm kind of the Cheech and Chong of Minnesota here. I've been smoking marijuana for 25 years, 35 years if I would have been able to, but I was only able to smoke it for 25 years since I was age 13. And I'm Cheech and Chong. I'm the anti-person that was here a minute ago. And what I can tell you is that it benefits people. It's a homeostatic modulator, which means that if your mental stuff is heading off some direction, your physical stuff is heading off some direction, when you put this plant in any way you want to smoke it, or you want to ingest it, it modulates you. It is a homeostatic modulator, and it is something that occurs naturally in the body. Now, people that have PTSD, this is very serious. These veterans go out and they lay their lives on the line for this country, and they come back and they are denied cannabis-related medications. And I am connected with people from Australia to Canada, all around this world, that are involved in medical research regarding marijuana. And one person I met the other night has, in Australia, an entire research, millions of dollars they're pouring into the one thing, the PTSD. So I'm here to stand today for everybody in this country that has PTSD, that the government did a patent on in 2003, and they have denied people this medication. So I have requested Minnesota Attorney General Lori Swanson and Wisconsin Attorney General Van Hollen initiate class action lawsuits against the United States government for this barbarism and sadistic withholding of medicine from citizens for political reasons, as from, again, Australia to Canada to Israel. The medical research is solid. It's real. this stuff helps people, and maybe the problem is that we can't talk about law enforcement tonight here, but maybe law enforcement should be looking at enforcing laws rather than lobbying for them. And then I felt so compelled after going to Denver, and when I walked up to these bud tenders and caregivers, I went up there for the recreational, being able to buy it legally there. And they weren't asking me, hey man, you know, do you want to, how high do you want to get? When I walked up to that person, they asked me, do you have any medical reasons that you're here for? And I said, yes, I do. And they said, well, what is it? I said, I'd like to be able to smoke this stuff and be able to function all day long. Is there stuff that will help me to work and focus and concentrate and be creative and not fall asleep on the couch? And I know marijuana very well, so I knew strains like that exist. You can't get them here. You're going to some person that you know, and then that person's a criminal, I'm a criminal, we're all criminals out here, but yet you can walk around with a cigarette in one hand and a drink in the other. Much more dangerous. So after going to Denver and after having experienced the freedom that you have in Denver, when I walked up to the counter, they asked me, what would you like? And again, I said something during the daytime that I can smoke all day and still function very, very well. And they had strains that would allow you to do that. And then I said, I have trouble sleeping at night. I'm 48 years old, and I have some insomnia. And then they said to me, well, the indica here would be really good for your insomnia. So the point is that I'm trying to make, this plant is medicine. It has an entire day type of a cycle to it called sativa. It has an entire night cycle to it called indica. And between the day cycle, which you can smoke all day long and stay uplifted, creative and all that, and then at night, if you need to get real sleep, instead of having to take Ambien and all these pills that have, I mean, look at this. For my issues, it's something that ends in 25 letters long. When you look at the side effects, it will tell you suicide. It will talk about homicide. And you know what? I don't want to kill myself. I don't want to kill anybody else. I don't need this for what I have. Oh, okay.
Could you wrap it up?
Yes.
And please,
finally, I would just...
One more thing.
Okay.
Please back away from the mic.
Okay, thank you. I'm a little animated on this, as you can tell. Final thing I wanted to say was that this is so important of an issue to me. The very concept that you would have law enforcement standing in between children and medicine when they cannot even test the untested rape kits in this state, this is morally wrong, and this must change. And then cannabis clowns is something that I feel so serious about this issue. Imagine those children, okay? And all this moral outrage around marijuana. And then when these children are going to get treatments about marijuana or cannabis, think how scared these kids are. And what I set up was something called cannabis clowns. And what that is that a child can have a clown come in and maybe not a bunch of pot flowers all over them. But
please wrap it up.
Yes, I'm trying to make children be able to get medicine, and the government needs to get out of all of our way and let us smoke whatever we want as long as we're not harming anybody else. Thank you.
Thank you. Michelle Gran.
Madam Chair.
That'll help. Thanks, Carlos.
Madam
Yes.
Chair, if I
Right,
could just
Representative
say
Cohen,
something
please.
real quick. I'm a police officer for the folks in this room that don't know, and I am a co-author on this bill. And we're working very hard to negotiate with all parties involved with this. And attacking the group right now isn't really not going to help. Let's talk about the health issues. That's what we're here to do. And let's move forward on this, because it is the right thing to do. I agree with that. But save your commentary on your being upset with law enforcement right now for another night.
Thank you, Representative Schoen. Appreciate that. Okay, Michelle Gran and then Keith Gran.
Thank you, Madam Chair, members. I have precisely a 2-minute statement, and I think it's a voice that you may not have heard yet.
And please just say your name into the mic.
Michelle Gran.
Thank you.
I'm the parent of a 26-year-old son who is in the small percentage of the population who experiences debilitating and likely irreversible side effects from marijuana use in his teen years and early adulthood. My intention here is not to argue either for or against legalizing medical marijuana, and I greatly respect and I heard all the testimony that has occurred before me. I only want to give you the benefit of my family's experience to weigh along with all of the other considerations pertaining to this legislation. As a patient in the University of Minnesota First Episode Psychosis program, my son is learning how to cope with the auditory hallucinations that are a profound feature of the mental illness arising during his marijuana addiction. Since his psychotic break in 2009, he's been unable to work or attend school, and as a result of his antipsychotic medications, he sleeps an average of 14 hours each day. He's not terribly productive at all. My husband and I have paid more than $40,000 out of pocket for medical treatment, which Blue Cross Blue Shield denied our family, denied him. We've learned that his schizoaffective disorder, which emerged when he was 21, was likely jump-started or perhaps even caused by his daily marijuana use. I provided very well-documented research pointing to the cause and effect of this in young adults. It wasn't until his traumatic psychotic break that we knew he was very, very sick. In fact, his experience is very representative of the dawning of this illness in teens and young adults nationwide. We, of course, this was hidden from all of us during those times. Kids are very good at keeping this from their parents. Aside from the convincing medical research, it's my personal opinion that marijuana abuse has reduced my son's previously very promising future to a future of very different outcomes and possibly lifelong dependence on county and state services. I'm aware that only a small percentage of those who use marijuana will experience these seriously negative side effects. But those who do could live with these consequences permanently. I'm sincerely grateful for the limited medical and social services to help him and others with psychiatric disorders in order to help them live a productive life. But I prefer that he and others never confronted these consequences. And I'm distressed that this reality is rarely raised in the public discussion of marijuana legalization. After much thought and education on the topic, I've concluded that while legalization is likely to benefit a very wide range of medical disorders, it will also open the door to produce additional psychiatric patients. We need to be realistic about that. As a parent and concerned citizen, I urge you to seriously consider the cost to the state caused by a potentially greater number of individuals developing psychiatric disorders through marijuana misuse, and read research which explains this link between marijuana and psychosis. And I thank you very much for your respectful consideration of my testimony.
All right, thank you very much. And I don't know whether other members have questions, but I'm just looking at what you just handed out to us, this study, Ms. Gran, and it says here that in this study of these 18-plus thousand patients who were discharged after first hospital admission for substance-induced psychosis, so this is the majority of them, 85.4%, had a diagnosis of alcohol-induced psychosis, then 4.5 were amphetamine-induced psychosis, and then you get down to the cannabis-induced, and it's 0.7%. Right. So it looks from what you just gave us, if we just had this to go on, that it's relatively very small compared to alcohol and amphetamine, which we know are commonly available substances and legal.
My intent only here is just to make certain that you hear the voice of those of us who've had to live through it, and just be aware that that is a cost.
Thank you very much.
Thank you.
Appreciate it. Oh, Representative Schoen.
Madam Chair and ma'am, I just wanted to clarify, and no disrespect, I didn't hear whether your son was using marijuana for medicinal purposes or illicitly. Oh, it was recreational?
Right.
Okay, thank you.
Okay, Keith Gronhout. Okay, I don't think he's here. Okay, I think that is everybody that's on the list to testify. I think in the packet there is an amendment that's, and I don't know if this is being offered or whose it is, so I think this would be the point. Is Representative Grunhagen?
Mm-hmm.
You have the floor.
Well, thank you, Madam Chair. Yeah, I'd like to move the A3 amendment.
Okay, Representative Grunhagen moves the A3 amendment. Would you please describe what you're doing here?
Thank you, Madam Chair. Members, I think this amendment might bring us together on this difficult and contentious subject. I will say this. I don't know, I agree with some of the testifiers. I don't know if, this is the forum to approve medical treatment for the citizens of the state of Minnesota. But be that as it may, we are where we are, okay? I appreciated Randy Costa's comment about the Board of Pharmacy and the administrative process. I don't want to grow government, but if this is the process for approving medical procedures that we're faced with, maybe that would be good to consider bringing that back. But basically what the bill does, if you look at lines 1.6 and 1.7, okay, it allows for the administration of marijuana in a liquid, pill, most importantly vaporization, which we heard from numerous testifiers, especially of the children and other individuals, but more importantly from the good Dr. Sisley, that vaporization is the most effective way of administering marijuana for a particular medical condition, because you can get the precise amount that you need for the condition you're experiencing. That's the words I wrote down. If they're different, Dr. Sisley, you're free to correct me on that, but I quickly wrote those down when you said that. The other thing it does exclude using medical marijuana in a smoking form, line 1.7. Then, rather than go through the rest of the details, which you can see, I would flip you to the second page, which is line 2.4 and 2.5. It does eliminate the ability to manufacture or grow your own marijuana. It would have to be administered through a medical practitioner. And I think when I look at this, number one, it fits the testimonies we've heard tonight. But number two, I really believe that if you eliminate the manufacture, cultivation, and smoking of the marijuana, you might have a better chance of getting law enforcement behind this, which the governor has said he won't sign the bill without their support. One more quick comment. What I see is by leaving smoking and cultivating and manufacturing, your own marijuana, we don't allow people to mix their own prescription drugs. I mean, when I go to the drugstore, I don't go back there and mix it myself. I rely on an expert to do it, okay? But here we're taking the position that they can grow, cultivate, and mix their own concoction together and administer it for their own needs. Now, there is some requirement to have a physician oversight on it. But I do believe, now I'm not saying this amendment doesn't need some work, but I'd be more than happy to work with Representative Melin and anybody else that would be interested in working this, because I'll be the first to admit I'm a layperson, okay? But I do think this takes us in a step where we could bring some compromise and togetherness on this, with a strong possibility of the governor and law enforcement supporting it. So I would strongly recommend approving this tonight, and we could go forward, and I'd be willing to work with Representative Melin or anyone else on this amendment.
All right.
Thank you, Madam Chair.
Thank you, Representative Gruenhagen. And members, do you feel like you know what this is? I'm going to, of course, let Representative Melin comment, but I wonder if staff should go through the amendment just so everybody knows what it does. So, Ms. Olson, are you the drafter? Maybe you could walk us through what it does, just to make sure we all understand.
Absolutely. Madam Chair, members of the committee, Representative Gruenhagen pretty much said everything that this really does. What it does is it changes the definition of the usable and the allowable amounts of marijuana. So the allowable amount of marijuana right now is just the pill, liquid, vaporization, injection, or other delivery method equivalent to 2.5 ounces. And then, as Representative Gruenhagen pointed out, lines 1.6 and 1.7 do change marijuana to the form of liquid, pill, vaporization, injection, or other delivery method that does not include smoking. That definition is then mirrored in subdivision 16, which is the usable marijuana definition. The rest of the amendment deletes references to when a qualifying patient was cultivating or manufacturing their own marijuana when they were outside of the range of a medical marijuana dispensary.
Okay, so Ms. Olson, then, just to be clear, so this would eliminate the permission to smoke the marijuana, and it would eliminate the cultivation by individual patients?
Madam Chair, that is correct.
Okay.
Madam Chair?
Representative
Just one
Gruenhagen.
quick thought. I really believe that's where we in Minnesota are, okay? That this amendment represents where the people are. I don't think the majority of Minnesotans want the abuse and recreation of marijuana and some of the consequences we've heard. But I do think they understand that there can be some medical relief for patients suffering certain conditions that are extremely painful, and even the drugs to use them with the side effects can be worse than the medical marijuana itself. So that's just my last comment.
Okay, thank you. I'm going to let Representative Melin comment on the amendment.
Thank you, Madam Chair and members, and thank you for sitting through that 3 hours of testimony. I appreciate that. And thank you, Representative Gruenhagen, for trying to make this bill better. And I have to say that I think there's actually a lot of things in your amendment that I would be willing to incorporate. There's a lot of things that I think we could make work. I'm not comfortable with throwing my support behind it right here and right now, but perhaps if you and I can get together and go through what some of these options could be so that we can make sure that we have a workable medical marijuana program in Minnesota, I am certainly willing and open to that discussion. Like I said, I think I see a couple things in your amendment that we could make work. I'm just not prepared to endorse it right now, but I would be happy to keep working with you. And I think that Dr. Sicily maybe can comment on some of the specifics as far as how the medicine is administered and whether or not this amendment would be workable. If she could come forward and provide
Sicily, if you would come
testimony.
up. Yeah.
Madam Chair, members of the committee, appreciate you letting me respond. It's Sue Sicily, and the amendment, there's a couple things that I wanted to address. First of all, the marijuana is not currently available in an injectable form, so that's something that you probably could just delete. But I would say that even though I was acknowledging that vaporization is often the most optimal delivery system for many patients, the fact is that a majority of the patients still do successfully smoke the plant and get excellent efficacy with very minimal side effects. The truth is that the testimony earlier that talked about there really is no association yet with marijuana smoke and lung cancer or any significant human body cancers right now. And NIDA has vigorously strived to look for that, and they haven't been able to uncover any direct association. There was a very important article in Chest, which is one of the most revered journals in our medical community, that published, in a peer-reviewed journal that they didn't see any association. So I think that to toss out a smoking option for patients who desperately need that, many of these patients have experimented with all these things, and except the injection, but they've experimented with vaporization, and some of our patients are so disabled. I don't know if anybody's looked at a vaporizer machine, but it's very cumbersome. And even though, they are excellent when they work, a lot of patients, if you have rheumatoid arthritis and your hands are deformed, you're just unable to manage it. You don't have the dexterity if you're sick. So I think that those patients, a lot of them are used to smoking. They know how to do it. And to take that option away from them would just add to the suffering and doesn't contribute to the benefit of the public health here. So I would say, I want to just make sure, I think vaporization is ideal, but it shouldn't be the only option. We have to look at the whole, breadth of patients here and try to accommodate the vast majority.
Okay, and Representative Albright.
For the doctor, thank you, Madam Chair. I'm a bit confused then by a couple of terms, and I hope you can help me out. Sure. I'm familiar with a nebulizer because my son suffered from pneumonia, and I'm trying to understand what the difference is between a nebulizer and a vaporizer.
Yeah, good question.
Dr. Sicily.
Madam Chair, members,
so a nebulizer uses actually kind of a warm, moist heat, whereas vaporizer is just the warm air being blown across the plant material. As the testimony earlier talked about, grinding up the plant, putting a little bit in that machine, the vaporizer machine. So that's the difference. Otherwise, it's similar. The medicine goes into a nebulizer. The only difference is you're getting moisture with the nebulizer, warm, moist air, vaporizer, just warm air. So similar concept, but same thing, that you're getting vapors from the medicine coming into a bag that people inhale then. So, but if you look at the machine, whether it's a volcano vaporizer or a whip vaporizer, several different versions, they're all when patients are sick, it's very difficult for them to manipulate that type of equipment easily and be able to deliver the medicine in a way that they need to. So.
Okay, Representative Albright. Okay, Representative Mack and then Grunhagen.
Thank you, Madam Chair. And kind of as a follow-up to Representative Albright, just kind of back, the chair referenced a little while ago, we talked about e-cigarettes last week, and that's referred to as vaping as a vaporizer. And from what I've seen, and those are the shape of a cigarette. I mean, they're not much heavier. They're not much. Can medical marijuana also be used in a device like that, in which case we're not talking about a cumbersome thing for someone if they can roll and essentially hold what we think of as a joint or something like that. If they can hold that and have the dexterity to hold that, wouldn't they also be able to have the dexterity to manage what we think of as e-cigarettes, but a vaporizer of that sort?
Right. Dr. Sisley.
Yeah, Madam Chair, members, I think that's a reasonable option, and some of that technology is slowly becoming available. It's been difficult. The pace of advancement in this industry is really slow because of prohibition. So I think someday those options will all be available, and probably the e-cigarette market will try to take that option over. But right now, I think these folks are already. They're seeking immediate relief, and they desperately need that. And I think we need to maintain that option. I think, the plant is very complex. There's 60 different phytocannabinoids in the plant, and when you try to manipulate it in different ways, like we've seen with the testimony earlier was asking about why we can't just utilize the pill form, for instance. But trying to synthetically reproduce the effects of this plant have proven impossible. Every time you try to do it, you just get a very suboptimal version of the plant itself. There's something really special about this plant that we don't understand fully. But I think that giving people, folks. It would be very tough. We've tried with many patients to force them to transition into vaporizing, and it often doesn't work well. And I think, if you're an 80-year-old hospice patient with end-stage cancer, and what is smoking cannabis, it would almost be inhumane to force them into a whole new delivery method. These folks are very sick, and they just need help.
Representative Mack?
Thank you, Madam Chair. Just a brief follow-up, and not to, disregard that point, but I guess just to kind of logically walk that across the finish line. If it's not legal right now, do we have 80-year-olds that are smoking marijuana that will have to adjust to a vaporizer? I guess maybe take issue with that.
Yeah.
That picture, because at least here in Minnesota, maybe people are doing it out of desperation and outside the bounds of our current law, but would we really be asking people to make a dramatic shift or change if theoretically they're not used to smoking it right now as a form of relief, if that makes sense, if that's a fair argument, just to your point?
Dr. Sisley.
Madam Chair, members, I'm not sure. I think part of the problem with not having a medical marijuana law in place is we really don't know the extent of how many people are actually using. I think this is going to be the importance of being able to legalize, create safe legal access, you're going to be able to bring people out of the shadows and start to really get a handle on how many people are actually using. That was the big surprise in Arizona. I was fascinated by how many elderly patients were actively buying marijuana on the black market to manage a variety of chronic, intractable illnesses. And now they're finally able to talk publicly about that. They were embarrassed, and you hear the stories of these folks here. I think it's going to be a very similar situation here, where you're going to see a lot of people emerge and have the courage to talk openly about it.
Okay, thank you. And Representative Melin, I guess somebody in the room wants to testify. Somebody wants to give more. Is it to the amendment, sir, or to the bill itself? Because we're on an amendment right now. So, yeah, so we won't take that right now, sir, because we're really off the testimony, and we're dealing right now with an amendment to the bill. So, okay, Representative Gruenhagen.
I just want to speak up on if we're going to vote after I'm done speaking.
We're going to vote on the amendment, yes.
After
I'm going to give, right, well, unless Representative Melin, you have something more to say, and then I'm going to give the author of the amendment the final word on the amendment. So.
Yes, Madam Chair, I just wanted to follow up to Representative Mack's question. We did hear testimony from Mr. Ramsey regarding the use of the vaporizer, and he said that he does have a small vaporizer, kind of what it sounds like you were just describing, and it doesn't work for him based on the amount of medicine that can be used in it, and so he does smoke instead to inhale the medicine. And he did mention that he couldn't afford an actual vaporizer, which is perhaps what the doctor is talking about, the more cumbersome process, and not being able to afford that at this time, so using other ways of inhalation. But, I think, Representative Gruenhagen, if you want to withdraw your amendment, I'd be happy to work with you on language that would work, because like I said, I think there's a number of things that we could make work in your amendment, and I would be happy to do that going forward. Otherwise, I would encourage members to oppose it, just based on I don't think we have enough information, and I'm worried that it wouldn't work for patients based on a lot of the testimony that we heard here this evening. And one thing I don't want to do is go down a route where we would end up with a program that would be unworkable for patients. So, if you and I can keep working together on language that we can make sure addresses your concerns and at the same time works for patients, I am more than willing to do that. Thank you, Madam Chair and members.
Okay, Representative Gruenhagen.
Well, thank you, Madam Chair. As far as administering the drugs, we've got plenty of people who can't administer their own drugs. I mean, that's what we've got home health care for, and other services. So I mean, it's just a matter of doing it. I just think, as far as I'm concerned, you keep smoking in there, and you keep cultivation in there, you're going to lose a lot of reps, and I think you're in danger of losing the police support or law enforcement support. If you eliminate that and concentrate on these other areas, I think that's the step where we're at right now, and it'll meet the needs of the people who really can benefit from this. The other thing, I know I've been an irritant to some of you, okay, and a little bit of a lightning rod at times, all right? My wife doesn't always appreciate what I say either, but the thing is, voted on its merits. And this gives us a chance today, and whether it fails or passes, I will work with Representative Melin, but send an indication to Representative Melin on if you'd like to see this type of thing. And I really believe here's a chance to eliminate the smoking and the cultivation, and I think you'll get rid of a lot of the controversy that surrounds this bill. So thank you, Madam Chair.
Thank you, Representative Gruenhagen. And this bill has a long way to travel, and there's plenty of opportunity for the author of the bill to worry about what she has to do to get it passed. So that, generally speaking, would be something that would be kind of for the author to work, and I'm sure she'd be happy to talk with you about that offline. So we're going to vote then on the A3 amendment. All those in favor, please say aye.
Aye.
All opposed, no? No. Division. Okay, a division's been called. All those in favor, please raise your hand. All those opposed?
Madam Chair, is it possible for me to amend my vote?
Yes, we have not announced the results, so let's, okay, I think we'll start again then since he wants. Okay. All right, all those in favor, please raise your hand. And all those opposed? Okay, so there being 8 ayes and 10 nays, the amendment does not prevail. No, and please, no demonstrations. We can't have demonstrations in the committee room. So we're on the bill, and and there is, we have concluded our testimony on the bill, so I'm sorry, but it is 20 after 9, and we are ready to vote. I think members are fully informed. So, fully worn out, yeah, somebody said. So, Representative Albright?
Yeah, Madam Chair, I just have a few questions for the author.
Okay. Representative Albright.
Looking, Representative Melin, on line 2.27, and I'll read it for you. It says, any other medical condition or its treatment approved by the Commissioner. And I'm just wanting for some discernment and or clarification in terms of what oversight the Commissioner would be subjected to in his discernment in terms of what additional treatments might be approved by him. Who would his oversight be?
Representative Melin?
Thank you, Madam Chair, and Representative Albright. So the Commissioner of Health would have discretion to certify other conditions going forward for treatment of medical marijuana. One example that's often cited to me is the New Mexico medical marijuana law, which did not allow PTSD as treatment for medical marijuana when it was first enacted, and a number of veterans groups petitioned the Commissioner of Health in New Mexico, and it was added to their medical marijuana laws there. And so we're providing that same mechanism to allow people to petition the Commissioner of Health in order to have a new condition certified. One example would be the seizure disorders that we heard a lot of testimony on from the parents. In 2009, when this bill, a similar bill to this, passed the legislature, and it was then vetoed in 2009, at that time we didn't even know that medical marijuana could be used to treat children with seizure disorders. And so, as we move forward and there's further discoveries and medical research and people are getting different results with different conditions, we just want to make sure that it's the Commissioner of Health deciding whether or not those conditions can qualify for treatment, so we don't go through this legislative process for every single condition that we may discover in the future can be treated with medical marijuana.
Representative Albright.
Thank you, Madam Chair. Then also to line 4.3 under subdivision 17, as it would pertain to a visiting qualifying patient. Would I read that to understand that this would be akin to a reciprocal or reciprocity from neighboring states for folks coming into the state that would want to utilize the system proposed?
Representative Melin?
Thank you, Madam Chair. And I have with me Heather Ozzie. She is with Compassionate Care Minnesota, and I think she's better equipped to answer that question if she's able to do so.
Okay, welcome to the committee.
Madam Chair, members, thank you. Yes, this visiting qualifying patient language would allow a patient from out of state who has been approved with a debilitating medical condition that is authorized within the terms of this legislation, who has a doctor from out of state. There is no access for a visiting patient in Minnesota. It would only allow for their possession, a very limited protection.
Representative Albright.
Thank you, Madam Chair. And then finally, on the bottom of that same page, line 4.34, I'm a bit I'm not confused, I'm trying to understand why it would be necessary under limitations, given what I've heard about the effects of cannabis and medical marijuana, why the necessity for while under the influence of marijuana. Could you just elaborate on that?
Representative Melin.
Thank you, Madam Chair and Representative Albright. And Representative Albright is referring to the section that allows for penalties, civil and criminal sanctions if somebody operates a motor vehicle or, some other equipment while under the influence of marijuana. That's actually current law as well.
Okay.
Impaired driving, which does include under the influence of marijuana. Obviously, a lot of the patients we heard from, none of them see a lot of the side effects that come along with medical marijuana because of the way that they're consuming it. But, there is THC in marijuana, and if it's consumed in a lot of amounts, I think that, if you could get to the level of being impaired. So our current laws prohibit you to drive if you're impaired under the influence of, any drug, not just marijuana, but OxyContin, any prescription medication as well. So this is just in line with that to say that even if you have a medical marijuana prescription, that doesn't mean you can operate a vehicle if you're if you're actually impaired from the prescription.
Thank you, Madam Chair.
Yeah, thank you, Representative Albright. Okay. So I think, seeing no other questions, I think we are fully informed and ready to vote on the bill. And so I will renew my motion that House File 1818 as amended be re-referred to the Committee on Government Operations. All those in favor, please say aye. Aye. All opposed, no?
No.
The motion prevails. Thank you.
Thank you, Madam Chair and members.
Please, no demonstrations. Be happy in the hallway. And we have one more bill, members, and do we need a 5-minute recess? Okay, all right, we will, otherwise I think it's abuse of the legislators. We'll take we will stand in recess for 5 minutes.
Hey, Glenn.